Cancer Dictionaries to explain cancer terms and words. Chapter 1. Cancer Dictionary websites. Huge Cancer Dictionary at cancer.gov/publication/dictionaries/cancer-terms ? Redirect = true. Really big, over 700 terms just for a. Chapter 2. A Cancer Dictionary in alphabetical order. A Cancer Dictionary from nccn.org/patients/resources/dictionary/default.aspx. A Cancer Dictionary from nccn.org/patients/resources/dictionary/default.aspx. ABCDE rule. Memory device for characteristics of moles that may be cancer. A equals asymmetry, B equals border, C equals color, D equals diameter, E equals evolving. Abdomen. The belly area between the chest and pelvis. Ablation. Treatment that destroys very small tumors. Treatment using radiofrequency to destroy cancer cells. Abrams needle biopsy. Tissue removal with a needle that limits the amount of air that enters the tissue. Accelerated phase. The second phase of chronic myelogenous leukemia, during which the number of blast cells is increased. Access port. A small device implanted under the skin that allows access to veins, sometimes called port a cath. Acral lentiginous melanoma. An uncommon type of melanoma that looks like bruise on the palms of the hands or soles of the feet, or like dark stripe in nail. Active myeloma. Myeloma that has spread throughout the bone marrow and is causing symptoms. Active surveillance. Delay of treatment with ongoing testing to watch for cancer growth. Acute leukemia. Fast-growing cancer that starts in blood-forming cells in the bone marrow. Acute lymphoblastic leukemia. Fast-growing cancer that causes too many immature white blood cells called lymphoblasts to be made in the bone marrow. Adenocarcinoma. Cancer that starts in cells that line organs and make fluids or hormones. Adenoma. Type of small growth in the gut's lining that is the most common and the most likely to become cancer. Also called adenomatous polyp. Adipose tissue. Loose connective tissue that stores fat cells. Adjunctive treatment. Medicine that is given with cancer treatment but is for symptoms caused by the cancer. Adjuvant chemotherapy. Type of cancer drug that is given after the main treatment used to cure the cancer. Adjuvant treatment. Treatment that is given after the main treatment used to cure the cancer. Adolescents and young adults, IAS. Patients who are 15 to 39 years of age. Adrenal gland. Small organ on top of each kidney that makes hormones. Advance directive. Written statements about your wishes for health care should you become unable to make these wishes known at later time. Adventiti. The fourth layer of the wall of the esophagus. Aggressive cancer. Cancer that spreads quickly. Albumin. The main protein in the yellowish part of the blood. Alkaline phosphatase, ALP. Protein found in most tissues of the body. Alkylating agent. Cancer drug that damages coded instructions in cells by adding chemical to them. Allergic reaction. Symptoms that are caused when the body is trying to rid itself of outside agents. Allogeneic STE, cell transplant. Cancer treatment that transfers blood-forming cells. Treatment in which the patient receives blood-forming cells, blood STE, cells, fro, another person. Alternative medicine. Treatments used in place of ones usually given by doctors. Alveoli. Tiny sacs in the lungs where gases are transferred in and out of the blood. Amosite asbestos. Straight, brittle, needle-like asbestos fibers. Amphibole asbestos. Group of asbestos fibers that are straight, needle-like, and brittle. Amyloid. An abnormal protein formed by clumps of excess light chains. Amyloidosis. Health condition in which protein called amyloid builds up in and damages organs. Anaplastic lymphokinase, ALK. Protein on the edge of cell that sends signals for the cell to grow. Androgen. Hormone that is found in high levels in males and is involved in sexual development and functioning. Androgen deprivation therapy, ADT. Treatment that stops the making or action of androgen hormones in the body. Also called hormone therapy. Anemia. Health condition in which the number of red blood cells is low. Anesthesia. Loss of feeling with or without loss of wakefulness caused by drugs. Anesthetic. Drug or other substance that causes controlled loss of feeling or awareness with or without loss of wakefulness. Angiogenesis. The growth of new blood vessels. Angiogram. Test that uses X-rays to make pictures of blood flow within an artery. Angiolymphatic invasion. Cancer that has spread into the lymph vessels or bloodstream. Anterior lobe. The part of the prostate that is above the urethra. Anterior zone. The top of the prostate. Anthracycline. Cancer drug that damages and disrupts the making of the genetic code in cells. Antiandrogen. Drug used to stop the action of the hormone testosterone. Antiandrogen withdrawal response. Decrease in prostate-specific antigens, PSA, when an antiandrogen drug is stopped. Antibiotic. Drug used to treat infections caused by bacteria. Antibody. Protein that helps the body fight off infections. Also called immunoglobulins. Protein made by plasma cells, type of white blood cell, that helps the body fight infections. Also called immunoglobulin. Anticoagulant. Drug that thins the blood to reduce the risk of blood clots. Antiestrogen. Drug that stops estrogen, hormone, FRO, attaching to cells. Antifungal. Drug that treats infections caused by fungus. Antimetabolite. Cancer drug that prevents the building blocks of the genetic code FRO, being used. Anus. The opening between the legs that allows stool to pass out of the body. Aortic lymph nodes. Groups of disease-fighting cells that are near the heart and aorta. Apheresis. Procedure in which STE, cells are removed FRO, blood. Apoptosis. The natural death of cells. Also called programmed cell death. Appendix. Small, pouch-like organ that sticks out FRO, the first part of the large intestine. Areole. Darker, circular area of skin on the breast surrounding the nipple. Aromatase inhibitor. Drug that lowers the level of estrogen, hormone, in the body. Arsenic. Very toxic metallic chemical. Arterial radioembolization. Treatment with radiation that is given through an artery to treat liver tumors. Artery. Tube-shaped vessel that carries blood FRO, the heart to the rest of the body. Arthralgias. Joint pain. Arthritis. Swelling of the bone joints. Asbestos. Mineral fiber used in housing and commercial materials. Group of minerals made of tiny fibers that are strong, flexible, and resistant to heat. Ascending colon. The first part of the colon along the right side of the body. Ascites. Abnormal buildup of fluid in the belly or abdomen, or pelvis. Asymmetry. One half or side of the mole does not match the other half or side. Asymptomatic. Having no signs or symptoms of disease. Atelectasis. Collapse of lung. Atypical mole. Mole that looks different FRO, normal or common mole. Autoimmune disorder. Disease that causes the immune cyst to attack the body. Autologous STE, cell transplant. Cancer treatment that removes, stores, then returns patient's blood-forming cells, blood STE, cells. Axillary. The body area under the armpit. Axillary lymph node dissection. Surgery to remove all the lymph nodes near the armpit, S. Surgery to remove all groups of disease-fighting cells that are near the armpit, S. Axillary lymph nodes. Groups of disease-fighting cells that are near the armpit, S. Azygous vein. Large vein on the right side of the spine within the chest. BCRABL gene. An abnormal set of coded instructions found in the Philadelphia chromosome. BRAF gene. Set of coded instructions in cell needed to make BRAF protein. Bacillus calmette-guerin. 4. Of dead tuberculosis, TB, used to activate the immune system. GER, similar to the one that causes tuberculosis that is given to activate the immune system. Bariu, enum. Test that fills the colon with fluid and air and then takes pictures using X-rays. Bariu, swallow. Test that uses X-rays and liquid with bariu, sulfate that is swallowed to make pictures of the organs in the upper gastrointestinal, GI, tract. Barrett's esophagus. The presence of stomach cells within the lining of the esophagus. Barrier birth control methods. Devices that prevent fro, entering the womb, uterus. Basal cell skin cancer. The most common type of skin cancer. Baseline test. Starting point to which future tests are compared. The first test results to which future test results are compared. Basophil. Type of white blood cell that helps the body respond to allergens. B cell. One type of white blood cell that turns into plasma cell in response to germs. 2. One of two main types of white blood cells called lymphoblasts that help protect the body from infection and disease. B-cell acute lymphoblastic leukemia. Fast-growing blood cancer, leukemia, that starts in an immature cell that normally becomes mature white blood cell called B-cell or B lymphocyte. Also called B-cell all. B-cell acute lymphoblastic leukemia. Fast-growing blood cancer, leukemia, that starts in an immature cell that normally becomes mature white blood cell called B-cell or B lymphocyte. Also called B-cell all. Bence-Jones myeloma. Condition in which myelin cells make only free light chains and no complete M proteins. Also called light chain myeloma. Benign. Mass of cells, or tumor, that aren't cancer. Benign prostatic hypertrophy. An overgrowth of tissue in the prostate that isn't caused by cancer. Also sometimes called benign prostatic hyperplasia. Beryllium. Hard, gray metallic chemical. Beta-2 microglobulin. Small protein made by many cells, including white blood cells and myelin cells. Bilateral. Involving both sides of the body. Involving both parts of an organ. Bilateral mastectomy. Removal of both breasts from the body. Bilateral oophorectomy. Removal of both ovaries from the body. Bilateral salpingo-oophorectomy. Surgery that removes both ovaries and both fallopian tubes from the body. Bile. Yellowish-brown fluid made by the liver that helps to digest food. Bile duct. Small tube-shaped organs that drain digestive fluid, bile, from the liver. Biliary bypass. Surgery to reroute the flow of bile from the common bile duct into the small intestine. Biliary stent. Small plastic or metal tube-shaped device used to unblock bile duct. Biliary tree. The cyst, of tube-shaped organs that drain digestive fluid from the liver. Bilirubin. Substance in the body that causes bodily fluids to be yellow. Yellow-brown substance that is removed from blood by the liver and is part of bile. Biochemical relapse. Rise in the level of prostate-specific antigen, PSA, after treatment for prostate cancer. Rise in the level of CA-125 after ovarian cancer treatment without symptoms or signs on imaging tests that the cancer has come back. Biochemotherapy. Treatment with drugs that boost the body's disease-fighting ability, immunotherapy, and drugs that kill fast-growing cells, chemotherapy. Biological therapy. Treatment used to help the immune system fight disease in the body. Biomarker. Substance found in body fluid or tissues that may be sign of cancer. Biopsy. Removal of small amounts of tissue or fluid to be tested for disease. Biphasic, mixed, subtype. Subtype of pleural mesothelium that has both organized, structured cells, epithelioid subtype, and long, spindle-shaped disorganized cells, sarcomatoid subtype. Birth canal. Hollow, muscular tube in women through which babies are born. Also called vagina. Birth defect. Physical, mental, or chemical abnormality in newborn babies. Bisphosphonate. Drug that helps to improve bone strength and prevent loss of bone mass. Bladder. An organ that holds and expels urine from the body. Blast cell. An immature cell that becomes mature blood cell. Blast phase. The final phase of chronic myelogenous leukemia during which the number of blast cells is very high. Blood cell count. The number of red blood cells, white blood cells and platelets in blood sample. Blood chemistry profile. Set of tests to see if there are abnormal amounts of chemicals in the body. Measurement of the amount of chemicals in the blood. Blood chemistry test. Test that measures the amount of certain substances in the blood to check for signs of disease. Blood clot. Mass of blood that forms when blood platelets, proteins, and cells stick together. Blood ste, cell. An immature blood cell from which all other types of blood cells are made. Blood thinner. Drug that thins out the blood to treat or reduce the risk of blood clots. Blood urinitrogen, BUN. Waste product made by the liver and filtered out of blood and into urine by the kidneys. Blood vessel. Hollow tube that circulates blood throughout the body. Bloodstream. Blood that flows throughout the body in small tubes called vessels. B lymphocyte. One of two main types of white blood cells called lymphocytes that help protect the body from infection and disease. Also called B cell. Board certified. Status to identify doctors who finished training in specialized field of medicine. Body mass index, BMI. Measure of body fat based on height and weight. Body plethysmograph. Test that measures how much air your lungs can hold and how much air is in your lungs after you exhale. Bolus. Fast injection of drug. Bone densitometry. Test that uses X-rays to make pictures that show how strong or thin bones are. Bone fracture. Crack or break in bone. Bone lesion. An area of bone damage. Abnormal tissue in the bone. Bone marrow. The soft, sponge-like tissue found in the center of most bones, where blood cells are formed. Bone marrow ASPI rate. Sample of fluid removed from the bone marrow to test for disease. Bone marrow aspiration. The removal of small amount of liquid bone marrow to test for disease. Bone marrow biopsy. The removal of small amount of solid bone and bone marrow to test for disease. Bone marrow cytogenetics. Test of sample of bone marrow to look for changes in the cell's chromosomes. Also called conventional cytogenetics. Bone metastasis. Cancer that has spread to the bones. Bone mineral density. Test that measures the strength of bones. Bone scan. Test that uses radioactive material to assess for bone damage. Bone survey. Set of X-rays of the entire skeleton to look for broken or damaged bones. Also called skeletal survey. Boost. An extra dose of radiation to specific area of the body. Border irregularity. The edges of mole are ragged or notched. Borderline ovarian cancer. An ovarian tumor with abnormal cells that aren't clearly cancer. Borderline resectable pancreatic cancer. Cancer that is confined to the pancreas but that approaches nearby structures or has severe symptoms so that it might not be possible to remove all the cancer with surgery. Bowel. Another name for the intestine. Also called the gut. Bowel obstruction. Health condition in which tumor is blocking stool from passing through the gut. Brachytherapy. Treatment with radioactive objects placed near or in tumor. Also called internal radiation. BRCA1 or BRCA2 genes. Coded information within cells that help to prevent tumor growth by fixing damaged cells and helping cells grow normally. Abnormal changes within these genes increases the chances of developing breast and ovarian cancer. Breast awareness. Learning about one's breasts. Breast duct. Hollow tube through which milk travels to the nipple. Breast implant. Small bag filled with salt water, gel, or both that is used to remake breasts. Breast lobules. Glands in the breast that make milk. Breast reconstruction. Surgery to create new breasts. Breast conserving therapy. Cancer treatment that removes breast lump then kills remaining cancer cells with radiation. The removal of whole lump and surrounding tissue in the breast, followed with radiation therapy. Breast low thickness. How deep the melanoma tumor has grown into the skin, measured in millimeters. Broad spectrum, sunscreen. Substance that protects the skin from the sun by blocking two types of harmful ultraviolet, UV, rays UV and UVB. Bronchi. The two airways extending from the windpipe into the lungs. Bronchiola. Branches of small airways within the lungs. Bronchopulmonary lymph nodes. Groups of disease-fighting cells that are near the main airways of the lungs. Bronchoscope. Thin, long tube through which tools are inserted to do work in the airways. Bronchoscopy. Use of thin, long tool that is guided into the airways to view or remove tissue. Bronchus. One of the two main airways that extend into the lungs from the windpipe. Busulfan. Chemotherapy drug used for chronic myelogenous leukemia before tyrosine kinase inhibitor treatment became standard practice. Bypass. Surgery to reroute the flow of fluid in the body. C19-9, cancer antigen 19-9. Proteins made by cancer cells and found in blood. CA125, cancer antigen 125. Protein with sugar molecules made by ovarian cancer cells as well as normal cells. Cadmium. Heavy metallic chemical. Calcium. Mineral needed for healthy teeth, bones and other body tissues. Mineral found in body tissues. Cancer grade. Measurement tool to describe how closely the cancer cells look like normal cells. Cancer screening. The use of tests to find cancer before signs of cancer appear. Cancer stage. The rating of the growth and spread of cancer. Cancerous. Cells that can grow within any type of tissue and spread to any part of the body. Also called malignant. Carbon dioxide, CO2. Natural chemical gas that has no odor or color. Gas that is released from the body during breathing. Carcinoembryonic antigen. Protein present in babies growing in the womb or when cancer forms. Carcinoma. Cancer that starts in cells that form the lining of structures. Cancer that starts in cells that form glands. Carcinoma in situ. Abnormal or cancer cells have not grown into the next layer of tissue. Carcinoma in situ of the breast. Breast cancer that has not spread beyond the breast ducts or lobules. Cardiac stress test. Test of how well your heart works during exercise. Cardiotoxicity. Having harmful effect on the heart. Carin. Firm, flexible, supportive tissue at the base of the windpipe. Carney-Stratocki syndrome. Health condition that is passed down from parents and marked by gastrointestinal stromal tumors. Castration therapy. Surgery that removes the testicles. Drugs that greatly reduce the level of testosterone in man's body. Cataract. Health condition in which the lens of the eye becomes cloudy. Catheter. Flexible tube inserted in the body to give treatment or drain fluid from the body. Cavernous nerves. Nerves that send signals to start penile erections. Celiac plexus. Group of nerves in the intestine that are toward the back of the upper part of the abdomen. Cell subtype. 1 different types of cancer cells that are grouped based on how the cells look when viewed with microscope. 2 smaller groups that leukemic Ls are classified into based on the specific type of lymphocyte affected. Cells. The building blocks of tissues in the body. Centers for Medicare and Medicaid Services, CMS. Federal government agency that runs Medicare and Medicaid. Central nervous cyst. The brain and spinal cord. Central nervous cyst, CNS, prophylaxis. Treatment given to prevent cancer cells from spreading to the fluid around the brain and spinal cord. Also called CNS preventive treatment. Central venous catheter. Thin, flexible tube that is inserted into vein in the upper arm, thigh, neck, or below the collarbone to deliver medication or collect blood. Central zone. The inner part of the prostate around the urethra. Cerebrospinal fluid. The fluid that surrounds the brain and spinal cord. Cervical cancer. Cancer that started in cells within the neck of the womb, which is called the cervix. Cervical lymph nodes. Groups of disease-fighting cells that are within the neck. Cervical pleura. The tissue lining around the lungs that extends into the neck area. Cervix. The neck of the womb that is attached to the birth canal. Chemoembolization. Treatment that cuts off blood supply to tumors with beads coated with chemotherapy. Chemoradiation. Treatment with combination of chemotherapy and radiation therapy. Chemotherapy. Drugs that kill cancer cells by damaging or disrupting the making of the genetic code. Drugs that stop the growth process of cells in an active growth phase. Drugs that kill fast-growing cells throughout the body, including normal cells and cancer cells. Chemotherapy cycle. Days of treatment followed by days of rest. Chest wall. The layer of muscles and bones under the skin that covers the chest area. Cholangitis. An infection of the small tube-shaped organs that drain digestive fluid from the liver. Chromio. Hard, semi-gray metallic chemical. Chromosome. The part of the cell's nucleus that contains strands of DNA, deoxyribonucleic acid. Long strands in cells that contain bundles of coded information for making and controlling cells. Chronic granulocytic leukemia. Type of leukemia that progresses slowly and causes too many white blood cells to form. Also called chronic myelogenous leukemia. Chronic leukemia. Slow-growing cancer that stars in blood-forming cells in the bone marrow. Chronic myelogenous leukemia. Type of leukemia that progresses slowly and causes too many white blood cells to form. Also called chronic myeloid leukemia. Chronic myeloid leukemia. Type of leukemia that progresses slowly and causes too many white blood cells to form. Also called chronic myelogenous leukemia. Chronic obstructive pulmonary disease, COPD. Trouble with breathing due to lung damage or too much mucus. Chronic phase. The first phase of chronic myelogenous leukemia during which patients do not usually report symptoms. Chrysotile asbestos. Long, curly asbestos fibers. Clark level. Scale of melanoma tumor depth with 5 scores based on which layer of skin the tumor has invaded. Clear cell. Type of ovarian cancer cell that is likely to grow and spread fast. Clear margin. The absence of cancer within the normal-looking tissue around the tumor. Clinical breast exa. Physical exa, of the breasts by health professional to feel for disease. Clinical relapse. Cancer symptoms or test results that suggest the cancer has returned after treatment. Clinical stage. The rating of the extent of cancer based on tests before treatment. Clinical trial. Research on test or treatment to assess its safety or how well it works. Clonal evolution. Changes in the coded instructions, genes, that allow cancer cells to survive cancer treatments and the body's attempts to destroy them. Coagulation test. Tests that show if blood is able to clot, coagulate, the way it should to control bleeding. Colectomy. Removal of all or part of the colon from the body. Colitis. Swelling of the colon. Colon. An organ that changes eaten food from liquid into solid form. Colonoscope. Thin, long tube through which tools are inserted to do work in the colon. Colonoscopy. Use of thin, long tool that is guided into the colon to view or remove tissue. Colorectal cancer. Cancer that starts in the colon, rectum, or both. Colostomy. Surgery to connect part of the colon to the outside of the abdomen. Combination chemotherapy. The use of 2 or more chemotherapy drugs for treatment. Combination regimen. The use of 2 or more drugs for treatment. Combined androgen blockade. Castration therapy combined with an anti-androgen drug. Common bile duct. Tube-shaped organ that transports digestive fluid from the liver into the gut. Complementary medicine. Treatment given along with standard treatment. Complete blood count, CBC. Test that measures the parts of blood. Complete blood count, CBC, with differential. Test of the number of blood cells as well as the different types of white blood cells in sample. Complete remission. No cancer cells are found in the blood, bone marrow, or other parts of the body, and all signs and symptoms of the cancer are gone. Complete remission. No leukemic cells are found in the blood or bone marrow, and all signs and symptoms of the cancer are gone. Complete response. The absence of all signs of cancer after treatment. Completion surgery. Follow-up surgery to remove woman's reproductive organs and possibly the omentum, nearby supporting tissue, and any remaining cancer that can be seen. Compression fracture. The collapse of bones in the spine. Break, fracture, in bone caused by the collapse of bones in the spine. Computed tomography, CT, scan. Test that combines many X-rays taken from different angles to make picture of the insides of the body. Concurrent chemoradiation. Chemotherapy given at the same time as radiation therapy. Conformal external BEA, radiation. Treatment with radiation that uses beams that match the shape of the tumor. Connective tissue. Supporting and binding tissue that surrounds other tissues and organs. Consolidation. The second round, phase, of treatment that is given when leukemic cells are no longer seen in the blood or bone marrow. Also called intensification or consolidation therapy. Continuation maintenance. 1 or more first-line drugs is continued. Contralateral. On the other side of the body than the symptom, or disease. On the other side of an organ than the symptom, or disease. Contrast. Dye that is put into the body to make clearer pictures during imaging tests. Control group. Patients in research who don't receive new treatment. Conventional cytogenetics. Test of sample of bone marrow to look for changes in the cell's chromosomes. Also called bone marrow cytogenetics. Conventional radiation therapy. Radiation that is given in small doses for weeks and targets both the tumor and some normal tissue. Conversion treatment. Treatments given to qualify person for surgery. Core needle biopsy. Removal of large tissue sample with wide, hollow needle to test for disease. Corticosteroid. Drug used to reduce redness, swelling and pain, but also to kill leukemic cells. Also called steroid. Costal plur. The lining of the lungs that has contact with the ribs and nearby muscles. Creatinine. Waste product of muscles that is filtered out of blood and into urine by the kidneys. Criteria. Standards for making decision. Criterion. Standard for making decision. Crocidolite asbestos. Straight, brittle, needle-like asbestos fibers. Crohn's disease. An inflammatory disease of the bowel. Cryoablation. Treatment that kills cancer cells by freezing them. Cryopreservation. The process of cooling and storing cells, tissues, or organs at very cold temperatures. Cryosurgery. Treatment that freezes tissue to kill cancer cells. CT-guided biopsy. Use of pictures from CT scan to find and remove tissue or fluid samples to test for disease. Curative treatment. Treatment used to fully rid the body of disease. Cycle. Days of treatment followed by days of rest. Cyst. Closed sac in the body filled with air or fluid. Cytochemistry. Test that uses special chemical dyes to identify the specific type of leukemia cell present in blood or bone marrow sample. Cytochemistry test. An assessment of the chemical parts of cells. Cytogenetic subtype. Smaller groups type of cancer is classified into based on abnormal changes in the chromosomes, long strands of coded instructions, of the cancer cells. Cytogenetic testing. Test that uses microscope to examine cells' chromosomes long strands of coded instructions in cells for making and controlling cells. Also called karyotyping. Cytogenetics. The study of the structure and function of chromosomes. Test that analyzes chromosomes, long strands of bundles of coded instructions in cells for making and controlling cells, to check for abnormal changes. Cytokeratin. Type of protein found on cells that line the surfaces of the body. Cytokines. Proteins made by the immune system. Substances made in the body that boost or activate the body's disease-fighting ability. Cytokines can also be made in lab. Cytopenia. Health condition in which the number of blood cells in general is low. Debulking surgery. Surgery that removes as much of the cancer as possible. Deep margin. Normal-looking tissue beneath tumor. Deep margin status. The presence or absence of cancer cells in the normal-looking tissue under tumor that is removed by surgery. Defecation. The release of stool from the body. Dehydration. Low amounts of fluids in the body. Dental abscess. Pus that is trapped in the tissues near the jaw. Deoxyribonucleic acid, DNA. Chain of chemicals inside cells that contains coded instructions for making and controlling cells. Dermal mitotic rate. Measure of how many melanoma cells are actually growing and dividing. Dermatologist. Doctor who's an expert in diseases of the skin. Dermatopathologist. Doctor who's an expert in testing skin cells and tissues for disease. Dermis. The second layer of skin that is beneath the top layer, epidermis. Descending colon. The third part of the colon that is on the left side of the body. Desmoid tumors. Mass of fibrous cells that can grow into nearby tissue but can't spread to distant sites. Desmoplasia. Growth of dense connective tissue. Desmoplastic melanoma. Melanoma tumor with dense connective tissue. Diabetes. Disease that causes high levels of blood sugar. Diagnose. To identify disease. Diagnostic bilateral mammography. Test that combines X-rays to make pictures of the insides of both breasts. Diagnostic imaging specialist. Person trained to read pictures of the body made by imaging tests. Diagnostic test. Test used to help identify disease in person with symptoms or signs of disease. Diaphragm. Sheet of muscles below the ribs that helps person to breathe. Diaphragmatic pleurer. The tissue lining around the lungs that is near the diaphragm. Diesel fumes. Gases from, thick, heavy fuel made from, crude oil. Differential. Measurement of the different types of white blood cells present in blood sample. Digestive cyst. Set of organs that breaks down food for the body to use. Digital rectal exa. Medical exa, of the prostate by feeling it through the wall of the rectum. Dissection. Cutting tissue away or apart in order to study. Disseminated metastases. Cancer that has spread to many sites distant from the first tumor. Distal pancreatectomy. Surgery that removes the middle part, body, and narrow end, tail, of the pancreas and other nearby organs. Distant metastasis. The spread of cancer cells from the first tumor to far site. Diversion. Surgery to attach the colon to the surface of the abdomen. Donor. Person who gives their organs, tissues, or cells to another. Donor lymphocyte infusion. Transfer of white blood cells to patient from person who gave the patient blood-forming cells. Doublet chemotherapy. Treatment with 2 chemotherapy drugs. Also known as combination chemotherapy. Drug interaction. Change in the way drug acts or works in the body when it is taken with another drug or substance. Drug intolerant. Strong, negative response of the body to drug. Drug potency. Strong drug effect. Drug resistance. Failed treatment response to drug. Drug transporters. Proteins in the body that are involved in the removal of drugs. Dry orgus. Having an orgus, without ejaculation. Dual energy X-ray, DEXA. Test that measures bone calcium content. Duct. Small tube or vessel in the body that fluids pass through. Ductal adenocarcinoma. Cancer that starts in cells that line the pancreatic ducts and make proteins that digest food. Ductal carcinoma. Cancer that started in cells that line breast ducts. Ductal carcinoma in situ, DCIS. Cancer that started within and has not grown beyond the breast ducts. Ductal lavage. Test that is used to collect cells fro, breast ducts. Duodenal bypass. Surgery to reroute the path that eaten food takes fro, the stomach to the small intestine. Duodenu. The first part of the small intestine, which absorbs nutrients fro, eaten food. Dysorgasmy. Pain during orgasm. Dysphagy. Difficult or painful swallowing. Dysplastic nevus. Abnormal mole. Mole that is large or has abnormal borders or more than one color. Early stage cancer. Cancer that has had little or no growth into nearby tissues. Eastern Cooperative Oncology Group, ECOG, Performance Scale. Rating scale of one's ability to do daily activities. Echocardiogram. Test that uses sound waves to make pictures of the heart. Edem. Swelling around tissues due to the buildup of fluid. Egg/eggs. Sex cell fro, woman that needs to be invaded by man's spur, to make baby. Also called ovum/ova. Ejaculate. Mix of spur and fluids. Also called semen. Ejaculation. The ejection of semen fro, the male body. Electrocardiogram, ECG. Test that shows the activity of the heart with line graph. Electrocardiography, ECG, machine. Machine that measures the electrical activity of the heart during exercise. Electrodes. Small devices that transmit electricity. Electrolytes. Minerals in blood that carry an electric charge and control some body functions. Electromagnetic. Force that attracts or repels and is produced by an electric current. Embryo. Fertilized egg that has been growing for up to 8 weeks. Endobronchial ultrasound, guided fine needle aspiration, EBUSFNA. Removal of tissue with thin needle at the end of long tube that is guided down the main airway using imaging tests. Endobronchial ultrasound, guided transbronchial needle aspiration, EBUSTBNA. Removal of fluid fro, the lung with needle that is guided with an imaging test into the main airway of the lung. Endocrine cells. Cells that make chemicals that activate cells or organs. Endometrial cancer. Cancer in the lining of the womb, uterus. Endometrioid ovarian cancer. One of 5 subtypes of cancer, which starts in the tissue lining around the ovaries. Endometrium. The inner lining of the womb. Endorectal coil. Thin wire covered with latex balloon. Endorectal magnetic resonance imaging, MRI. Type of MRI that takes pictures through the rectum. Endoscope. Thin, long tube through which tools are inserted to do work in the digestive tract. Endoscopic biopsy. Use of thin tool that is guided down the esophagus to remove tissue samples. Endoscopic mucosal resection, EMR. Treatment that removes small tumors with tools guided down the esophagus. Endoscopic polypectomy. Removal of small growth fro, the guts lining with small tools guided into the colon. Endoscopic retrograde cholangiopancreatography, ERCP. Test that uses thin, lighted tube and X-rays to see the pancreatic ducts and bile ducts. Endoscopic ultrasound, EUS. Tool that is guided down the esophagus and makes pictures using sound waves. Endoscopic ultrasound, guided fine needle aspiration, EUSFNA. Removal of fluid with needle that is guided with an imaging test down the esophagus. Endothoracic fasciae. The tissue lining of the chest wall. Enum. Injection of liquid into the rectu, to clear the gut. Engraftment. When transplanted STE, cells begin to make blood cells in patient's bone marrow. Enzymes. Proteins that speed up chemical reactions in the body. Proteins that help to digest food. Eosinophil. Type of white blood cell. Epidermal growth factor receptor, EGFR. Protein on the edge of cell that sends signals for the cell to grow. Epidermis. The outer layer of skin. Epididymis. The hollow tube behind each testicle in which spur mature. Epididymitis. The swelling of the tube in which spur mature after leaving the testicles. Epidural anesthesia. Loss of feeling in the lower half of the body furrow, an ongoing injection of drugs into the outermost part of the spinal canal. Epithelial cell. Type of cell that forms the lining of structures or that for glands. Epithelial ovarian cancer. Cancer that starts in cells that for the outer layer of tissue that lines the ovaries. Epithelial tissue. Thin, dense tissue that covers most surfaces inside the body. Epithelioid subtype. The most common cell subtype of malignant pleural mesothelioma. Cells of the epithelioid subtype are uniform, and in organized patterns. Epithelium. Tissue that forms the lining of organs or that forms glands. Erectile dysfunction. The inability to achieve erection sufficient for intercourse. Erionite. Mineral fiber similar to type of straight, brittle, needle-like asbestos fiber. Erythropoietin. Drug used to treat low red blood cell counts. Esophagectomy. Removal of all or part of the esophagus furrow, the body. Esophagogastrectomy. Removal of the esophagus and some of the stomach furrow, the body. Esophagogastric junction. The area where the esophagus and stomach join. Esophagus. The tube-shaped organ between the throat and stomach. Estrogen. Hormone that develops female body traits. Drug used in men to stop cells furrow, making testosterone. Excision, excise. Removal by surgery. Excisional biopsy. Removal of an entire tumor to test for disease. Excisional lymph node biopsy. Removal of the entire, enlarged lymph node, S, to test for disease. Excisional skin biopsy. Surgery that removes the entire skin tumor to test for cancer cells. Exocrine cell. Type of cell that makes proteins that help digest food. External BEA, radiation therapy, EBRT. Treatment with radiation received furrow, machine outside the body. External sphincter. Muscle that controls the flow of urine furrow, the bladder through the urethra. Extracapsular extension. Cancer growth through the prostatic capsule. The tumor has grown beyond the edge of the organ into nearby tissue. Extraosseous. Occurring outside the bone. Extrapleural pneumonectomy, EP. Surgery that removes the affected lung and all its tissue lining, the sheet of muscles below and sometimes the tissue lining around the heart. Fair complexion. Light-colored hair, eyes, and/or skin. Fallopian tube. The female organ through which an egg travels furrow, an ovary to the womb. Familial adenomatous polyposis. Health condition that is passed down furrow, parents and increases the chance of getting colon cancer. Fasciae. Deep layer of soft tissue. Fat pad. The fat that is just under the skin of the abdomen. Fatigue. Severe tiredness despite getting enough sleep that limits one's ability to function. Feces. Unused food passed out of the body. Also called stool. Fertility. The ability to have babies. Fertility specialist. An expert who helps women to get pregnant and have babies. Fertility-sparing surgery. Removal of only one ovary and one fallopian tube so that woman can still have babies. Fibrosis. The scarring of supportive fibers in tissue. Fine needle aspiration, FNA. Use of thin needle to remove fluid or tissue from the body to test for disease. First-line treatment. The first set of treatments given to treat disease. Fistule. Passage between two organs that are not normally connected. Flap. Tissue taken from one area of the body and used in another area. Flexible sigmoidoscopy. Use of thin tool with tools that is guided into the sigmoid colon to view or remove tissue. Flow cytometry. Test that assesses substances on the surface of cells to identify the specific type of cells present. Fluorescence in situ hybridization, FISH. Test used to identify the presence or absence of DN, deoxyribonucleic acid, segments. Lab test that assesses genes, coded instructions for making and controlling cells, or chromosomes, long strands containing bundles of genes, in cells to check for abnormal changes in genes. Fluorodeoxyglucose, FDG. Mix of fluoride and glucose used to see cancer on certain imaging tests. Follicle stimulating hormone, FSH. Hormone made by the ovaries. Follow-up testing. Close watch by your doctors for cancer using tests. Tests done after treatment to check for signs that the cancer has come back. Food and Drug Administration, FDA. Federal government agency that regulates drugs and food in the United States. Forceps. Tool that is shaped like tongs used to grab and cut tissue. Four-dimensional computed tomography, 4D CT. CT scan that can show the movement of organs. Fracture. Crack or break in bone. Fragmented specimen. Tumor that was removed from the body in pieces. Free light chain. Fragments of M proteins that are made by myelin cells. Fusion gene. Gene that is made from parts of two separate genes. Gallbladder. Small organ that holds digestive fluid, bile, from the liver. Gardner's syndrome. Health condition that is passed down from parents and increases the chance of getting sarcoma. Gas diffusion. Test that uses harmless gas to measure how much person can breathe out. Gastroenterologist. Doctor who is an expert in digestive diseases. Gastroesophageal reflux disease, GERD. Frequent backwash of stomach contents into the esophagus. Gastrointestinal, GI, tract. The group of organs through which food passes after being eaten. Gene. Set of coded instructions in cells needed to make new cells and control how cells behave. Gene mutation. Abnormal change in the coded instructions in cells for making and controlling cells. Also called genetic mutation. General anesthesia. Controlled loss of wakefulness from drugs. Genetic condition. Health problem, caused by abnormal changes in the coded instructions within cells, genes. Genetic counseling. Discussion with health expert about disease that is caused by abnormal information in cells that is passed down from parents. Genetic defect. An abnormal set of coded instructions within cells that are needed for making new cells and controlling how cells behave, genes. Genetic marker. Specific set of coded instructions within cells that are needed for making new cells and controlling how cells behave, genes. An abnormal set of coded instructions within cells that are needed for making new cells and controlling how cells behave, genes. Genetic mutation. An abnormal set of coded instructions within cells that are needed for making new cells and controlling how cells behave, genes. An abnormal change in the coded instructions within cells that are needed for making new cells and controlling how cells behave, genes. Genetic risk. The chance of getting disease due to cell information that is passed on from parents. Genetic tests. Tests that assess the chance for disease caused by coded instructions in cells. Tests of the coded instructions in cells that are needed to make and control cells. GER, cells. Cells that become spur in men and eggs in women. Gilbert's disease. High bilirubin levels caused by abnormal coded instructions in cells that are passed down fro, parents. Glaber's skin. Skin that naturally does not have hair. Gland. Small organ that makes fluids or hormones. Glandular cell. Type of cell, located in gland, that make fluids or hormones. Glandular tissue. Groups of cells, located in gland, that are able to make fluid. Gleason grade. Score fro, 1, best, to 5, worst, made by pathologist based the ability of prostate cells to 4, glands. The primary grade is the most common pattern and the secondary grade is the second most common pattern. The two grades are summed to give Gleason score. Gleason score. The grading cyst, for prostate cancer based the ability of prostate cells to 4, glands. Glucose. Natural sugar in the body that is used by cells for energy. Good risk feature. Something linked with lower chance, risk, that cancer will come back after treatment. Graft versus host disease, GVHD. Disease that occurs when transplanted STE cells attack patient's normal cells. Graft versus tumor, GVT, effect. An attack on cancer cells by transplanted STE cells. Also called graft versus leukemia, GVL, effect. Granulocyte. Type of white blood cell named for its small granules, particles. Gray units, GY. Measure of radiation dose. Groin. The area of the body where the thighs join the pelvis. Ground glass opacity. Small mass of lung cells with low density. Growth factor. Substance that helps new blood cells to be made. Guaiac stool test. Test that finds hidden blood in stool. Gut. Another name for the intestine, which is the organ food passes through after leaving the stomach. Also called the bowel. Gynecologic oncologist. Doctor who is an expert in cancer that starts in women's organs that help to make babies. H2 blocker. Drug that reduce acid. Hadron therapy. Treatment with radiation that uses proton beams. Hair follicles. Tube-like openings in the skin where hairs grow. Hairy skin. Skin that naturally has hair. Heavy chain. The longer protein chain that is part of an antibody. Hematologist. Doctor who is an expert in diseases of the blood. Hematopoietic STE, cell. Non-specialized cell that can change into any blood or marrow cell. Immature blood-forming cell located in the bone marrow, the soft, sponge-like tissue in the center of most bones where blood cells are made. Hematopoietic STE, cell transplant, HSCT. Treatment that replaces damaged or diseased bone marrow with healthy blood-forming cells, blood STE, cells. Hematospermy. Blood in semen. Hematury. Blood in urine. Hemoptysis. Coughing up blood. HER2 overexpression. High levels of activity of the HER2 gene that causes too much protein to be made. Hereditary. Trait that is passed down fro, parent to child through coded instructions in cells, genes. Hereditary cancer. Cancer that is caused by abnormal coded instructions in cells that are passed fro, parent to child. High-dose chemotherapy. An intensive drug treatment to kill cancer and disease-fighting cells so transplanted STE cells are not rejected by the body. High-dose rate brachytherapy. Treatment with radioactive objects that are removed fro, the tumor after the radiation dose has been given. High-grade dysplasia, HGD. Precancerous change in cells. Hilar lymph nodes. Groups of disease-fighting cells where the main airways enter the lungs. Histologic grade. Rating of how much cancer cells look like normal cells. Histologic subtype. The type of cancer based on the traits of the cells. Histologic typing. The study of cells to classify disease. Hives. Itchy, swollen, and red skin caused by the body trying to rid itself of an outside agent. Hodgkin lymphoma. Cancer that starts in white blood cells. Hormone. Chemical in the body that activates cells or organs. Hormone receptor. Protein on the edge of cells to which hormones attach. Hormone receptor, negative. Cancer cells that do not use hormones to grow. Hormone receptor, positive. Cancer cells that use hormones to grow. Hormone replacement therapy. Drugs used to increase hormone levels. Hormone therapy. Treatment that stops the making or action of hormones in the body. Hormone therapy, refractory. Lack of response to 3 hormone regimens given one right after the other. Hospice care. Physical and emotional care for people who are close to the end of life. Hot flashes. Health condition of feeling intense heat and body sweat for short periods of time. Human epidermal growth factor receptor 2, HER2. Protein on the edge of cell that sends signals for the cell to grow. Human leukocyte antigen, HLA, type. The unique set of proteins on the surface of white blood cells that help the body to identify its own cells foreign cells. Human leukocyte antigens, HLA, typing. Blood test that helps to identify person's unique set of proteins on white blood cells. Human organic cation transporter 1, HOCT1. Drug transporter. Hydroxyurea. Chemotherapy drug used for chronic myelogenous leukemia before tyrosine kinase inhibitor treatment became standard treatment. Hypercalcemia. High levels of calcium in the blood. Hyperplastic polyp. Type of growth in the gut's lining, often found in the rectum, that grows fast. Hyperviscosity. Condition in which the blood becomes very thick because of too many proteins in the blood. Hypnotherapy. Treatment that puts people into trance-like state of deep relaxation. Hypodermis. The layer of fat and supporting tissues under the second layer of the skin, dermis. Hypofractionated regimen. Treatment with radiation that isn't given every day. Hypokalemia. Low levels of potassium in the blood. Hypomagnesemia. Low levels of magnesium in the blood. Hypophosphatemia. Low levels of phosphorus in the blood. Hysterectomy. Surgery that removes the womb, uterus. In situ. In its original place describing cancer cells have not spread where they first formed. In situ hybridization, ISH. Test that counts the number of copies of specific set of coded instructions in cells. In situ lentigo malign. Slow-growing skin tumor caused by cancer cells that have not grown beyond the first layer of skin. Iliac lymph nodes. Groups of disease-fighting cells in the pelvic area. Image-guided radiation therapy, IGRT. Treatment with radiation that uses imaging tests to better target the tumor. Imaging test. Test that makes pictures of the insides of the body. Imatinib mesylate. Drug that blocks the activity of protein called tyrosine kinase. Imiquimod Kriya. Drug made as Kriya that boosts or activates the body's disease-fighting ability. Immune cells. Cells that are part of the body's natural defense against infection and disease. Immune response. The action of the body's natural defense against infection and disease in response to foreign substance. Immune suppression. The condition in which the body's natural defense against infection and disease, immune system, is weakened. Immune cyst. The body's natural defense against disease. The group of organs and cells that defends the body against diseases. Immune therapy. Treatment that uses the body's natural defense against disease. Also called immunotherapy. Immunoglobulin. Protein made by plasma cells that helps fight off infection. Also called an antibody. Immunohistochemistry, IHC. Test of cancer cells to find specific cell traits involved in abnormal cell growth. Immunophenotype. The unique set and pattern of proteins on the surface of white blood cells that can be used to identify the type of cell. Immunophenotyping. The process of identifying the specific type of cells present based on the unique set of proteins on the surface of the cells. Immunotherapy. Treatment that uses the body's natural defense against disease. Also called immune therapy. Implant. Ovarian cancer cells that have spread fro, the first tumor to the surface of nearby organs and structures in the belly area. Also called seeds. Small bags filled with saline liquid, silicone gel, or both that are used to rebuild breasts. In situ polyp cancerous growth that has not grown beyond the first layer of the colon wall. In vitro fertilization, IVF. The fusion of sperm into an egg outside the body. Incidental finding. An unplanned finding of disease. Incision. Surgical cut into the body. Incisional biopsy. Surgery that removes tissue sample fro, tumor to test for cancer cells. Indigestion. Feeling of discomfort, such as heat, burning, or pain, in the upper belly area. Induction. The first round, phase, of treatment given to rid the body of leukemic cells. Also called remission induction or induction therapy. Induction chemotherapy. Type of cancer drug that is given as the first treatment for cancer. Infectious disease. An illness caused by germs. Inferior pulmonary vein. Vein that returns blood fro, the lungs back to the heart. Infertility. Physical inability to have babies. Inflammation. Redness, heat, pain, and slash or swelling fro, injury or infection. Inflammatory bowel disease. Health condition that causes the gut to swell. Informed consent for. Document that must be read, understood, and signed by person wanting to take part in research study. Infraclavicular. The area below the collarbone. Infusion. Method of giving drugs slowly through needle into vein. Medical procedure that slowly injects substances into the bloodstream. Inguinal lymph nodes. Groups of disease-fighting cells that are in the groin area. Inguinal region. The area of the body where the thighs join the pelvis. Also called the groin. Inorgasmi. The inability to have an orgasm. Insulin. Chemical that controls the amount of sugar in the blood. Integrative medicine. Use of standard treatment with complementary therapies that are safe and work together. Intensity modulated radiation therapy, IMRT. Treatment with radiation that uses small beams of different strengths based on the thickness of the tissue. Interferon. Drug used to activate the body's disease-fighting ability, immune system. Interferon alpha. Drug used to activate the body's disease-fighting ability, immune system, to fight cancer cells. Interleukin-2. Drug used to activate the body's disease-fighting ability, immune system, to fight cancer cells. Intermittent therapy. Alternating periods of time on and off treatment. Internal mammary. The body area along the breastbone. Internal radiation therapy. Treatment with radiation received fro, radioactive object placed near or in the tumor. Interoperative radiation therapy, IORT. Radiation therapy given during surgery. Interstitial radiation. Type of internal radiation therapy that places radioactive objects in the tumor. Intestine. The tube-like digestive organ between the stomach and anus. The organs that food travels through after leaving the stomach. In-transit metastases. Melanoma tumors that have spread into lymph vessels more than 2 cm away fro, the first tumor, but not into lymph nodes, groups of disease-fighting cells. In-transit recurrence. Melanoma that has come back after treatment in lymph vessels more than 2 cm away fro, the first tumor but not in lymph nodes, groups of disease-fighting cells. Intraoperative. During the course of surgery. Intraoperative radiation therapy, IORT. Radiation therapy given during surgery. Intraperitoneal, IP, chemotherapy. Drugs given by small tubes surgically placed in the abdomen, belly area. Intrapulmonary nodes. Groups of disease-fighting cells that are in the lungs near the small airways. Intrathecal, IT, therapy. Cancer drugs that are injected into the fluid that surrounds the brain and spinal cord, the bundle of nerves that runs fro, the base of the skull down the back. Cancer drugs that are injected into the fluid that surrounds the brain and spinal cord, the bundle of nerves that runs fro, the base of the skull down the back. Intrauterine birth control devices. Objects that are placed in the womb and release drugs to prevent pregnancy. Intravenous. Receipt of substance by needle inserted into vein. Intravenous, 4, chemotherapy. Drugs given by needle or tube inserted into vein. Invasive breast cancer. Cancer cells that have grown into the supporting tissue of the breast. Invasive colon cancer. Cancer cells that have grown through the first layer of the colon wall. Invasive disease. Cancer cells that have grown into supporting tissues of organs or structures. Invasive implant. Ovarian cancer cells that have spread fro, the first tumor, and invaded the supporting tissues of another structure. Invasive tumor. Mass of cancer cells that has grown into supporting tissue of organs or structures. Ipilimumab. Drug used to activate the body's disease-fighting ability, immune system, to fight cancer cells. Ipsilateral. On the same side of the body as the symptom. On the same side of the body as the disease. Isolated limb infusion/perfusion. Anti-cancer drugs are given directly into an AR, or leg, in way that they do not reach or affect the rest of the body. Jaundice. Yellowing of the skin and eyes. Jejunostomy tube, J-tube. Feeding tube that is inserted through cut made into the intestine. Cras gene. Set of coded instructions in cell for making KRAS protein. Karnofsky scale of performance status, KPS. Rating scale of one's ability to do daily activities. Rating scale of one's general health. Karyotype. Map of chromosomes according to their size and shape. Karyotyping. Process that examines map, karyotype, of cells' chromosomes, long strands of bundles of coded instructions for controlling cells. Keratinocyte. Type of cell in the outer layer of the skin. Ketoconazole. An antifungal drug that is used to stop cells fro, making testosterone. Kidney. One of pair of organs that removes waste fro, blood, helps control blood pressure and helps to make red blood cells. KIT. Molecule within chemical pathway that starts cell growth. Kyphoplasty. Surgery to support the spine with balloon device and type of cement. Lactate dehydrogenase, LDH. Protein that helps to make energy in cells. Lamin propria. Supportive tissue within the first layer of the colon wall. Supportive tissue within the first layer of the esophageal wall. Langerhans cell. Type of cell in the outer layer of skin. Laparoscope. Thin, long tube through which tools are inserted to do work in the belly area. Laparoscopic radical prostatectomy. Removal of the prostate using thin, long cutting tool that is inserted through small cut in the pelvis. Laparoscopy. Use of thin, long tool that is inserted through small cut made in the abdomen. Surgery that uses thin, long tube with light and Camrand possibly tools, to remove tissue, inserted through small cut made in the belly area. Laparotomy. Removal of tissue through long, up and down cut made in the abdomen. Large intestine. The digestive organ that prepares unused food to leave the body. Large cell lung carcinoma. Type of lung cancer that lacks features to classify it as any other carcinoma. Laser therapy. Use of intense, narrow beams of light or carbon dioxide to cut into the surface of the skin and kill cancer cells. Lateral lobe. The largest part of the prostate that is on the left and right sides of the organ. Laxative. Drug that is used to clean out the intestines. Lentigo malign melanoma. The slowest growing type of melanoma, It starts in sun-exposed skin and is commonly mistaken for sunspot. Lesion. Tissue that has been damaged by disease or injury. Leucovorin calcium. Drug that improves how well 5-FU, type of chemotherapy, works. Leukemia. Cancer of the bone marrow or blood. Cancer that starts in blood-forming tissue, bone marrow. Leukemia cell. Abnormal, immature white blood cell that grows and divides all the time without control. Leukocyte. Another name for white blood cell. Levator muscles. Muscles that support the prostate and control the flow of urine. Libido. Sexual desire or emotions related to sex. Li-Fraumeni syndrome. Health condition that is passed down from parents and increases the chance of getting sarcoma. Light chain myelin. Myelin cells that make only free light chains and no complete M proteins. Also called Bence-Jones myeloma. Light chains. The shorter protein chain that is part of an antibody. Limb infusion. Method of giving drugs slowly through needle directly into leg or arm. Limb perfusion. Method of giving drugs through needle directly into leg or arm. Limited metastases. Cancer that has spread to one or few distant sites. Liquid nitrogen. Cooling of the chemical, nitrogen, to liquid state. Liver. An organ that removes waste from the blood. Liver function test. Test that measures chemicals made or processed by the liver. Lobe. Clearly seen division in an organ. Clearly seen division in part of the body. Lobectomy. The removal of an entire lobe of the lung. Lobular carcinoma. Cancer that started in the lobular cells of the breast. Lobular carcinoma in situ, LCIS. Abnormal cells that have not spread beyond the breast lobules. Lobule. Gland in the breast that makes breast milk. Local anesthesia. Loss of feeling in small area of the body caused by drugs. Controlled loss of feeling in small area of the body due to drugs being administered to that area. Local cancer. Tumor that has not spread far. Local melanoma. Cancer cells have not spread beyond the skin near the first, primary, tumor. Local metastasis. The spread of cancer cells from the first tumor to nearby site. Local recurrence. Cancer that has come back after treatment in or near the same place as the first, primary, tumor. Local therapy. Treatment that affects cells in one small, specific part of the body only. Also called local treatment. Local treatment. Treatment that affects cells in one small, specific part of the body only. Also called local therapy. Localized perforation. Holes made in the colon from tumor. Locally advanced cancer. Growth of cancer outside of the first, primary, tumor into nearby tissues. Long-term side effect. An unhealthy or unpleasant physical or emotional response to treatment that continues for months or years after finishing treatment. Low-dose computed tomography, LDCT. Test that uses little amounts of radiation to make pictures of inside the body. Low-dose rate brachytherapy. Treatment with radioactive objects that are inserted into tumor and left to decay. Lumbar puncture. Insertion of thin needle into the spinal column to remove fluid or to give drugs. Also called spinal tap. Lumpectomy. Surgery to remove the whole breast lump and some normal breast tissue. Lung. One of pair of organs that is made of airways and air sacs. Lung capacity. The amount of air the lungs can hold. Luteinizing hormone releasing hormone, LHRH. Hormone made in the brain that helps regulate estrogen production by the ovaries in women. Luteinizing hormone releasing hormone, LHRH, agonist. Type of drug that acts on the brain to stop the testicles from making testosterone. Type of drug that acts on the brain to stop the ovaries from making estrogen and progesterone. Lymph. Clear fluid that contains disease-fighting white blood cells. Lymph node. Small group of disease-fighting cells. Lymph node dissection. Removal of all groups of disease-fighting cells cluster. Removal of some or all nearby groups of disease-fighting cells. Lymph node recurrence. Cancer that has come back after treatment and has spread to lymph nodes, groups of special disease-fighting cells. Lymph node sampling. Removal of one group of disease-fighting cells cluster for testing. Lymph vessel. Tube-shaped ducts that carry lymph throughout the body. Lymphadenectomy. Surgery to remove lymph nodes. Lymphatic. Relating to the cyst, made up of lymph nodes, and lymph vessels. Lymphedema. Swelling due to buildup of clear liquid that has white blood cells, lymph. Lymphoblast. Immature blood cell that develops into white blood cell called lymphocyte. Lymphocyte. Type of white blood cell that helps to protect the body from infection. Lymphoid. Referring to type of white blood cell called lymphocyte. Lymphomas. Cancer that starts in the cells of the immune system. Lymphovascular invasion. Spread of cancer into lymph or blood vessels. Lynch syndrome. Health condition that is passed down from parents and increases the chance of getting colorectal. MDR1. Drug transporter gene. Magnetic resonance cholangiopancreatography, MRCP. Test that uses radio waves and powerful magnets to make pictures of the pancreas and bile ducts. Magnetic resonance imaging, MRI. Test that uses radio waves and powerful magnets to make pictures of the insides of the body. Magnetic resonance spectroscopy. Test that measures chemicals in cells without removing tissue from the body. Main pancreatic duct. Tube-shaped vessel that drains digestive fluids from the pancreas into the gut. Maintenance treatment. Treatment given to continue good treatment results. Treatment given in lower dose or less frequently to maintain good treatment results. Malignant. Cancerous, growing out of control. Mammogram. Picture of the insides of breast that is made by test that uses X-rays. Mammography. Test that uses X-rays to make pictures of the insides of the breast. Margin status. The presence or absence of cancer cells in the normal-looking tissue around tumor. Marrow. Soft tissue found in the center of bones. Mastectomy. Surgery to remove the whole breast. Median lobe. Part of the prostate that can enlarge and grow into the bladder to cause difficulties urinating. Mediastinal lymph nodes. Groups of disease-fighting cells that are in the center of the chest. Mediastinal pleura. The tissue lining around the lungs that is near the center of the chest. Mediastinoscope. Thin, long tube through which tools are inserted to do work in the center of the chest. Mediastinoscopy. Use of thin, long tool that is inserted through cut near the breastbone to view or remove tissue. Mediastino. The chest area between the lungs where the heart is. Medical history. All health events and medications taken to date. Medical oncologist. Doctor who is an expert in cancer drugs. Medical skin exa. Careful examination of your skin by doctor to check for any areas that look abnormal. Medication adherence. The extent to which you take your medication as prescribed and directed by your doctor. Medullary carcinoma. Cancer that looks like the lower half of the brainstem. Megakaryocyte. Type of blood cell that makes platelets. Melanin. Pigment in the skin. Substance that gives color to the skin. Melanocyte. Cells that give skin its color and are located in the lower part of the top layer of the skin, epidermis. Melanoma. Cancer that starts in the cells that give color to the skin, melanocytes. Melanoma in situ. Melanoma cancer cells that are only in the outer layer of the skin, epidermis. Melphalan. Chemotherapy drug. Menopause. The point in time when woman will experience no more menstrual periods. Menstrual cycle. Changes in the womb and ovaries that prepare woman's body for pregnancy. Menstrual period. The flow of blood and tissue from the womb to outside the body. Also called menstruation. Menstruation. The flow of blood and tissue from the womb to outside the body. Also called menstrual period. Merkel cell. Type of cell in the outer layer of skin. Mesentery. Double layer of the tissue lining around the abdomen that is attached to digestive organs. Mesothelium. Rare cancer that starts in the tissue that covers most organs inside the body. Mesothelium. Single layer of cells that makes lubricating fluid and that lines most organs inside the body. Messenger RN, mRNA. Molecule that carries genetic information to sites where protein is made. Metabolic. Having to do with chemical changes that take place in cell. Metachronous metastases. The spread of cancer after treatment to sites far from the first tumor. Metaplastic carcinoma. Cancer that changed from one cell type to another. Metastasectomy. Surgery to remove tumors that formed far from the first site of cancer. Metastasis. The spread of cancer cells from the first, primary, tumor to distant site. Metastatic. Containing cancer cells that have spread from the first tumor. Metastatic recurrence. Cancer that has come back after treatment in tissues nearby or far from where the cancer started. Micropapillary carcinoma. Cancer with cells in fern-like pattern. Microsatellite instability. Abnormal changes in genetic information that happen when the genetic information is being copied. Microsatellitosis. Tiny tumors near the main tumor that can only be seen with microscope. Microscope. Tool that uses lenses to see things the eyes cannot. Microscopic. Something so small that it cannot be seen by the naked eye. Microscopic metastases. Cancer cells that have spread from the first tumor and cannot be seen by the naked eye. Microtubule inhibitor. Type of drug that stops cell from dividing into two cells. Mini transplant. Cancer treatment that uses low doses of chemotherapy before blood-forming cells are transferred from another person, donor, to patient. Minimal residual disease, MRD. Very small amount of cancer cells left in the body after treatment that can't be seen with microscope. Minimally invasive surgery. The use of small tools inserted through small cuts to do surgery. Mitotic rate. The time it takes for melanoma cells to grow and divide. Mixed carcinoma. Cancer that has more than one cell type. Mole. Dense area of melanin. Spot on the skin formed by cluster of cells that make melanin, substance that gives skin its color. Molecular test. Test of abnormal coded instructions in cells or the proteins that help cancer cells grow. Monitoring tests. Tests done during treatment to check if treatment is working. Monoclonal antibody. Type of immune cyst, protein made in lab that can attach to substances in the body such as cancer cells. Monocyte. Type of white blood cell. Monotherapy. The use of one type of therapy to treat disease. M protein. An antibody made by myelin cells that does not fight germs. Also called monoclonal protein. Mucinous breast cancer. Type of breast cancer that has lot of mucus around the cells. Also called colloid breast cancer. Mucinous ovarian cancer. One of 5 types of cancer that starts in the tissue lining around the ovaries. Mucose. The first, inner layer of the colon wall. The first, inner layer of the esophageal wall. Mucus. Sticky, thick liquid that moisturizes or lubricates. Mucous membrane. Thin layer of cells that line open spaces of the body and make sticky, thick liquid, mucus. Multi-agent chemotherapy. The use of 2 or more cancer drugs. Multidisciplinary T. Group of healthcare professionals who are each experts in different areas of treatment related to cancer. Multimodality treatment. Combination of different types of treatment. Multiparameter flow cytometry. Test that measures myelin cells in the bone marrow. Multiple myelin. Cancer of plasma cells that has spread throughout blood marrow. Multiple primary tumors. One or more unrelated masses of cancer cells. Multiple catheter radiation. Treatment with radioactive seeds that are placed in the body with small tubes. Muscularis mucosae. Thin layer of muscle within the first layer of the colon wall. Thin layer of muscle within the first layer of the esophageal wall. Muscularis propria. The third layer of the colon wall made that is mostly of muscle. The third layer of the esophageal wall that is made mostly of muscle. Mutation. An abnormal change in cells coded instructions for making and controlling cells. Mutation analysis. Test that looks for abnormal changes in the coded instructions in cells for making and controlling cells. Myeloblast. An immature blood cell that develops into white blood cell called granulocyte. Myeloid. Having to do with bone marrow, or referring to type of white blood cell called granulocyte. Myelin cell. An abnormal plasma cell that grows and divides all the time. Myelin therapy. Drugs that are used to treat myelin throughout the body. Myeloperoxidase. Chemical found in type of white blood cell called granulocyte or myeloid cell. Myelosuppression. Condition in which the bone marrow is weakened and makes fewer blood cells. MYH-associated polyposis. Health condition that is passed down from parents and increases the chance of getting colon cancer. Nasogastric tube. Feeding tube that is inserted down the nose and into the stomach. Navigational bronchoscopy. Use of thin tool that is guided into the smallest airways of the lung to view or remove tissue. Needle biopsy. Use of needle to remove tissue from the body for test for disease. Negative margin. The absence of cancer cells in the normal-looking tissue around the tumor that is removed during surgery. Neoadjuvant chemotherapy. Chemotherapy given to reduce the size of tumor before surgery to remove it. Neoadjuvant treatment. Treatment that is given before the main treatment used to cure disease. Nerve graft. The transplant of nerves from one area of the body to another. Nerve-sparing prostatectomy. Surgery that removes the prostate but spares one or both bundles of cavernous nerves. Neuroendocrine cell. Type of cell that sends chemical messages when activated by the nervous system. Neuroendocrine prostate cancer. Cancer that starts in prostate cells that send chemical messages when activated by the nervous system. Neuropathy. Nerve problem that causes pain, tingling and numbness in the hands and feet. Neurotropies. Melanoma cells that are able to invade nerves. Neutropenia. Disorder caused by low levels of type of white blood cell neutrophils. Neutrophil. Type of white blood cell. Nevus. The medical term for mole. Nickel. Silvery white metal. Nipple. The darker, raised part of the breasts. Nipple replacement. The rebuilding of breast nipple. No evidence of disease, NED. Period of time when tests show no signs of disease. Nodal basin. Cluster of lymph nodes, groups of disease-fighting cells, that are near to one another. Nodal extracapsular extension. The tumor in the lymph node, group of disease-fighting cells, has grown beyond the edge of the node. Node negative. Groups of disease-fighting cells that do not have cancer. Node negative recurrence. Cancer that has come back after treatment but has not spread to lymph nodes, groups of special disease-fighting cells. Node positive. Cancer cells are found in lymph nodes, groups of special disease-fighting cells. Node positive recurrence. Cancer that has come back after treatment and has spread to lymph nodes, groups of special disease-fighting cells. Nodular melanoma. Type of melanoma that has dome shape and may grow more quickly into the second layer of skin, dermis, than other melanomas. Nodule. Small mass of tissue. Nomogra. Tool that uses clinical information to predict an outcome. Non-adherence. Not taking your medication as prescribed or directed by your doctor. Non-invasive. Cancer cells that have not grown into another type of tissue. Non-invasive disease. Cancer cells that have not grown into supporting tissues of organs or structures. Non-invasive implant. Ovarian cancer cells that have spread through the first tumor but have not invaded the supporting tissues of other structures. Non-melanoma skin cancer. Cancer of the skin that starts in cells other than melanocytes, cells that give skin its color. Non-metastatic recurrence. Cancer that has come back after treatment but has not spread to parts of the body far away from the first, primary, tumor. Non-myeloablative hematopoietic STE, cell transplantation, HSCT. New approach to HSCT that requires less chemotherapy and radiation therapy. Non-peritonealized. Not connected to the tissue lining that covers the abdomen. Non-solid nodule. Small mass of tissue with low density. Normal range. Set of values that is based on test results of healthy people. Nucleus. The control center of the coded instructions within cell. Nutritionist. An expert in healthy foods and drinks. Obesity. High amount of body fat compared to body height. Observation. Period of testing for cancer growth. Testing on regular basis so that supportive care can be given if prostate cancer symptoms are likely to start. Period of scheduled follow-up testing to watch for signs of cancer spread, metastasis, or recurrence. Occult carcinoma. The presence of cancer cells although tumor has not been found. Occupational therapist. An expert in helping people live life unaided or with devices. Oligosecretory myeloma. Myeloma that makes very few or no M proteins. Omentectomy. Removal of the double layer of fatty tissue that covers the organs in the belly are, omentum. Omentu. The double layer of fatty tissue that covers the organs in the belly area. Oncofertility. Cancer doctors and reproductive experts who work together to help patients keep their ability to have babies. Oncology. Branch of medicine that deals with cancer. Oncology surgeon. Doctor who is an expert in cancer surgery. Oophorectomy. Surgery to remove an ovary. Open biopsy. Removal of samples of tissue or fluid through small cut. Open retropubic prostatectomy. Removal of the prostate through one long cut in the abdomen and pelvis. Open surgery. Removal of tissue through one large cut. Orchiectomy. Removal of the testicles from the body. Organ. Part of the body that performs certain function. Organ reserve. How well organs are working. Orthopedic surgeon. Doctor who is an expert in operations of the bones. Osseous. Occurring inside the bone. Osteonecrosis. Death of bone cells. Osteopontin. Type of protein found in bone. Osteoporosis. Disease that causes bones to thin and weaken. Ovarian ablation. Methods used to stop the ovaries from making hormones. Ovarian suppression. Methods used to lower the amount of hormones made by the ovaries. Ovary. One of pair of organs in females that makes eggs, ova, and hormones. Overflow incontinence. Leakage of urine due to an overly full bladder. Ovum/ov. Sex cell fro, woman that needs to be invaded by man's sperm, to make baby. Also sometimes called an egg or eggs. Oxygen. Gas in the air that the body needs to live. Pack years. The number of cigarette packs smoked every day multiplied by the number of years of smoking. Palliative care. Treatment for symptoms of disease. Also sometimes called supportive care. Pancreas. An organ that makes digestive fluids and chemicals to control blood sugar. Pancreatic duct. Small tube in the pancreas that transports digestive fluids. Pancreatic protocol computed tomography, CT. CT scan that is done in certain way so that all of the pictures focus specifically on the pancreas to clearly show the pancreas, nearby blood vessels and tiny tumors. Pancreatic protocol magnetic resonance imaging, MRI. An MRI scan that is done in certain way so that all of the pictures focus specifically on the pancreas to clearly show the pancreas, nearby blood vessels and tiny tumors. Pancreatidoadenectomy. Removal of the head of the pancreas and parts of other nearby organs. Also called Whipple procedure. Pap test. Procedure in which cells are removed from the neck of the womb, cervix, to be tested for disease. Paracentesis. Use of thin tube or needle that is inserted through the belly to remove fluid sample to be tested for disease. Paresthesia. Sensations of burning, tingling, or pinpricks. Parietal pleur. The outer layer of the lining around the lungs. Partial breast irradiation. Treatment with radiation that is only directed at the surgery site. Partial response. When some, but not all, signs and symptoms of cancer are gone after treatment. Particles. Small pieces of matter. Part solid nodule. Small mass of tissue with areas of low and high density. Pathologic stage. Rating of the extent of cancer based on tests given after treatment. Pathologist. Doctor who is an expert in testing cells and tissue to find disease. Pathology report. Document listing all the results of laboratory tests. Document with information about cells and tissue removed from the body and examined with microscope for disease. PDGFR. Molecule within chemical pathway that starts cell growth. Pectoralis minor muscle. Muscle in the upper chest. Pediatric protocol. Detailed plan of medical treatment for children. Pediatric regimen. Treatment plan that specifies the drug, dose and schedule for course of treatment designed for or given to children. Pediatric inspired. Based on treatment designed for or given to children. Pedunculated polyp. Growth in the guts lining that has shape like mushroom. PEG interferon or PEG interferon alpha 2b. Long-acting type of interferon drug used to activate the body's natural defense against cancer. Pelvic exa. Medical exa, of the female organs in the pelvis. Pelvic lymph node dissection. Removal of groups of disease-fighting cells within the pelvis. Pelvic wall. Layer of muscles and tissue that helps organs in the pelvis stay in place. Pelvis. The body area between the hip bones. Penile curvature. An abnormal curve of penis during an erection. Penile erection. The stiffening of the penis from blood filling its sacs. Penile shrinkage. Decrease in the length or girth of penis. Penis. Male organ used for sex and urination. Percent-free prostate-specific antigen, PSA. The percentage of an unbound for, of PSA. Percutaneous. Through the skin. Percutaneous endoscopic gastrostomy, PEG. Feeding tube inserted through small cut into the stomach. Percutaneous needle biopsy. Insertion of needle through the skin and into mass to remove tissue for testing. Perforation. Hole in body tissue. Performance status. Rating of person's general health. Rating of person's ability to do daily activities. Perfusion scanning. Test that assesses blood flow in and out of the lungs. Peribronchial nodes. Groups of disease-fighting cells around the main airway of the lungs. Pericardial effusion. Excess fluid between the two tissue layers of the heart's lining. Pericardiocentesis. Use of needle inserted between the ribs to remove fluid around the heart. Pericardio. The tissue lining around the heart. Pericolic lymph nodes. Groups of disease-fighting cells that are near the colon. Peridiaphragmatic lymph nodes. Groups of disease-fighting cells that are near the diaphragm. Perimenopause. When menstrual periods occur less often, but before they completely stop, menopause. Perineum. The body arraign men that is between the scrotum and anus. The body arraign women that is between the vulva and anus. Perineural invasion. The spread of cancer into nearby nerves. Periodontal disease. Disease of the gums in the mouth. Peripheral blood. Blood that is outside the bone. Peripheral margin. The normal-looking tissue around the sides of tumor that is removed during surgery. Peripheral margin status. The presence or absence of cancer cells in the normal-looking tissue around the sides of tumor removed during surgery. Peripheral zone. The back of the prostate near the rectum. Peripherally inserted central catheter, PICC line. Thin, flexible tube inserted through the skin into vein then guided to larger vein to give chemotherapy. Perirectal nodes. Groups of disease-fighting cells that are near the rectum. Peritoneal cavity. The large space between the two layers of the tissue lining in the belly are, abdomen. The area inside the belly are, abdomen, that contains the abdominal organs such as the intestines, stomach, and liver. Peritoneal washings. Special liquid that is tested for cancer cells after it is used to wash the insides of the belly are called the peritoneal cavity. Peritoneum. The tissue lining around the abdomen. Persistent cancer. Cancer that is not completely removed or destroyed by treatment. Persistent melanoma. Cancer that is not completely removed or destroyed by treatment. Persistent melanomas found in or right next to the surgical scar where the first melanoma was removed. Also called true local scar recurrence. Phase. Rating or description of the progression of chronic myelogenous leukemia, CML, in the body. Philadelphia chromosome, PH chromosome. Shorter chromosome 22 that is formed after parts of chromosome 9 and 22 switch with each other. Ph-negative leukemia. The leukemic cells do not contain the Philadelphia chromosome. Photodynamic therapy. Treatment with laser that activates drug inside the tumor. Photon BEA. Stria, of particles that have no mass or electric charge. Ph-positive leukemia. The leukemic cells contain the Philadelphia chromosome. Phrenic nerve. Bundle of fibers that sends signals between the spine and the muscles used to breathe. Physical exa. Review of the body by health expert for signs of disease. Pigment. Substance with color. Placebo. Fake medicine that has no active agents. Plain radiograph. Test that uses X-rays to make picture of the insides of the body. Plasm. The yellowish liquid part of blood that carries blood cells. Plasma cell. White blood cell that makes germ-fighting proteins. Plasma cell labeling index. Test that shows how many myelin cells are dividing and how fast they are doing it. Plasmapheresis. Process that removes M proteins from the blood. Plastic surgeon. Doctor who's an expert in operations to improve function and appearance. Platelet. Type of blood cell that forms blood clots to control bleeding. Platinum, chemotherapy. Treatment with chemotherapy drugs that are made with platinum. Platinum, doublet. Treatment with 2 chemotherapy drugs that are made with platinum. Platinum-based chemotherapy. Treatment with 2 or more chemotherapy drugs of which the main drug is made with platinum. Platinum resistant. Lack of treatment response to chemotherapy drug made with platinum. Platinum sensitive. Treatment response to chemotherapy drug made with platinum. Pleur. The 2 layers of tissue lining around the lungs. Pleural biopsy. Removal of sample of the tissue lining around the lungs to test for disease. Pleural catheter. Tube that drains fluid from the chest. Pleural cavity. The space between the 2 layers of tissue lining around the lungs. Pleural effusion. An excess of fluid between the 2 tissue layers of the lining of the lungs. Pleural fluid. The fluid in the space between the 2 layers of tissue lining around the lungs. Pleural mesothelium. Cancer that starts in cells that form the tissue lining around the lungs. Pleural mesothelium. Layer of cells in the tissue lining around the lungs that makes lubricating fluid. Pleural plaque. Concentrated area of scarring in the tissue lining around the lungs. Pleural thickening. Widespread scarring in the tissue lining around the lungs. Pleurectomy/decortication, P/D. Removal of the tumor and the affected part of the tissue lining around the lung. Pneumonectomy. Surgical removal of the entire lung. Pneumonia. Severe inflammation of the lungs. An infection that causes the lungs to fill up with pus. Pneumonitis. Swelling of the air sacs in lung. Pneumothorax. Collapsed lung. Polymerase chain reaction, PCR. Sensitive lab test that is used to look for abnormal changes in cells' genes, coded instructions for controlling cells, and chromosomes, long strands of genes. Polyp. An extra growth of tissue furrow, within the first layer of the colon wall. Polypectomy. Removal of an extra growth of tissue furrow, within the first layer of the colon wall. Poor risk feature. Something linked with higher chance, risk, that cancer will come back after treatment. Port. Surgical opening into the body. Portal vein embolization. Blockage of the blood vessel to the liver tumor which causes the healthy liver to grow. Positive lymph nodes. The presence of cancer within groups of disease fight cells. Positive margin. The presence of cancer within the normal-looking tissue around the tumor that is removed during surgery. Positron emission tomography, PET. Test that uses of radioactive material to see the shape and function of body parts. Positron emission tomography/computed tomography, PET/CT. Test that uses radioactive material and X-rays to view the shape and function of organs and tissues. Posterior lobe. The back of the prostate near the rectum. Postmenopause. The state of having no menstrual periods for 12 months or more. Post-remission therapy. Treatment given after all signs and symptoms of cancer have disappeared, called remission, following initial treatment. Potent. Degree of strength or intensity. Premenopausal. The state of having regular menstrual periods. Primary chemotherapy. The first-line chemotherapy given to treat cancer. Primary resistance. Failure of the body to respond to drug taken for the first time. Primary treatment. The main treatment used to rid the body of cancer. Primary tumor. The first mass of cancer cells in the body. Progesterone. Hormone that is found in high levels in women and is involved in sexual development, menstruation, and pregnancy. Prognosis. The expected pattern and outcome of disease based on tests. Prognostic factor. Something that affects or helps predict the likely outcome of disease. Prognostic scoring cyst. Cyst, used to help gauge the likely outcome of disease based on certain factors. Progression. The growth or spread of cancer after being tested or treated. Promyelocyte. Type of precursor cell that develops into mature white blood cell. Prophylactic. Describing medical procedure to prevent disease. Prophylaxis. Treatment that aims to prevent disease. Prostate. Male gland that makes fluid for protecting furrow, acid in the vagina. Prostate-specific antigen, PSA. Protein made by the prostate. Prostate-specific antigen, PSA, density. Comparison of the level of PSA, the size of the prostate. Prostate-specific antigen, PSA, doubling time. The time it takes for the level of PSA double. Prostate-specific antigen, PSA, level. The number of nanograms per milliliter of PSA. Prostate-specific antigen, PSA, velocity. How much the level of PSA over time. Prostatic capsule. The tissue that covers the prostate. Prostatic fluid. Whitish, thick liquid made by the prostate. Prostatitis. Swelling of the prostate. Proteasome. Group of proteins in cells that helps control cell growth and division. Protein. Chain of small chemical compounds, called amino acids, that is vital to every cell. Protocol. Detailed plan of medical study, treatment, or procedure. Proton BEA. Stria, of positively charged particles that emit energy within short distance. Proton BEA, therapy. Treatment with radiation that uses stria, of positively charged particles that emit energy within short distance. Proton pump inhibitor, PPI. Drug that reduces acid. Puberty. The time when teens sexually develop. Pulmonary fibrosis. Major scarring of lung tissue. Pulmonary functioning tests. Set of breathing tests to test the strength of the lungs. Pulmonary pleur. The inner layer of the tissue lining around the lungs. Also called visceral pleura. Pulmonologist. Doctor who is an expert in lung diseases. Punch biopsy. Surgery to remove tissue with round-shaped knife to test it for disease. Pure desmoplasy. The growth of dense connective tissue throughout melanoma tumor. Pus. Yellowish thick fluid in an area of inflammation. QTC prolongation. Lengthening in time between two specific electrical cycles, T and Q waves, of the heart. Quality of life. The satisfaction with one's well-being. Quantitative immunoglobulins. Test that measures the amount of different types of antibodies in the blood and urine. Quantitative perfusion test. Test of the blood flow in the lungs. Quantitative reverse transcriptase polymerase chain reaction, qPCR. Test that makes copies of genetic information to look for any abnormalities. Quantitative ventilation test. Test of the airflow in the lungs. Radial growth phase. Horizontal growth of melanoma within single layer of skin. Radiation boost. An extra dose of radiation to specific area. Radiation entrythes. Swelling of the colon wall. Radiation field. The area of the body that receives radiation. Radiation oncologist. Doctor who an expert in treating cancer with radiation. Radiation therapy. The use of radiation to treat cancer. Radical perineal prostatectomy. Removal of the prostate through the skin that is between the scrotum and anus. Radical prostatectomy. Removal of the entire prostate. Radical retropubic prostatectomy. Removal of the prostate through one cut made in the lower abdomen. Radioactive. Containing powerful energy called radiation. Radiofrequency ablation. Treatment that kills cancer cells with heat. Radiographic relapse. The growth of cancer after treatment that is seen on imaging tests. Radiologist. Doctor who is an expert in reading imaging tests. Radionuclides. Radioactive drugs that enter bones to kill cancer cells. Radiopharmaceutical. Drug that contains radioactive substance. Radiotracer. Radioactive material that is used to make pictures of body parts. Substance that releases small amount of radiation. Matter with energy that is put into the body to make pictures clearer. Radon. Gas without odor, taste, or color that is made from decaying uranium. Randomized. Assigned to group by chance. Rate. The frequency of an event within specific time period. Receptor. Protein within cells to which substances can attach. Rectu. The last part of the large intestine. An organ in the digestive cyst, that holds stool until expelled from the body. Recurrence. The return of cancer after disease-free period. Recurrence symptoms. Physical signs that the cancer has returned after disease-free period. Recurrence treatment. Treatment of cancer that returned after disease-free period. Recurrent cancer. Cancer that has returned after disease-free period. Recurrent laryngeal nerve. Bundle of fibers that sends signals between the spine and voice box. Red blood cell. Type of blood cell that carries oxygen from the lungs to the rest of the body. Red marrow. The soft tissue in the center of most bones where blood cells are formed. Refractory. Disease that does not improve or go away in response to treatment. Regimen. Treatment plan that specifies the dosage, schedule, and duration of treatment. Regional anesthesia. Type of drug used for short-term loss of feeling or awareness in part of the body without loss of wakefulness. Controlled, temporary loss of feeling or awareness in part of the body caused by drugs without loss of wakefulness. Regional lymph node recurrence. Cancer that has come back after treatment in lymph nodes, groups of disease-fighting cells, near the first tumor. Regional melanoma. Cancer cells have spread from the first tumor to nearby lymph vessels, lymph nodes, groups of disease-fighting cells, and/or nearby skin. Regional treatment. Treatment with cancer-killing drugs directed to specific area of the body. Relapse. The worsening or return of cancer after period of improvement. Remission. The signs and symptoms of cancer have disappeared as result of treatment. Remission induction. The first round, phase, of treatment that is given to rid the body of leukemic cells and make all signs and symptoms of the cancer disappear. Also called induction or induction therapy. Reproductive cyst. The organs and tissues involved in the process of making babies. Resectable. Cancer that can be removed by surgery. Resection. Surgery to remove tumor. Residual tumor. Cancer that was not removed during surgery. Respiration. The transfer of gases in and out of the body. Respiratory cyst. The group of organs that transfers gases in and out of the body. Retractors. Tool that holds back the edges of surgical cut. Retrograde ejaculation. Semen that is not ejaculated but flows back into the bladder. Retroperitoneal lymph nodes. Groups of disease-fighting cells that are behind the intestines. Retroperitoneum. The space in front of the spine in the lower trunk. Retropubic. Behind the pubic bone. Rheumatoid arthritis. An autoimmune disorder that causes pain, swelling and stiffness in the joints. Ribonucleic acid, RNA. Molecule that is chemically similar to DNA and carries the same genetic code. Risk evaluation and mitigation strategy, REMS. PROGRA, to test for and manage serious side effects of cancer treatments. Risk factor. Something that increases the chance of getting disease. Risk reduction. Something that is done to try to lessen the chance of getting disease. Robot-assisted prostatectomy. Surgery that removes the prostate with the help of machine. Salvage therapy. The treatment given after standard treatment fails. Treatment that is given after the first or previous treatment fails. Sarcomas. Cancer that starts in bones or soft tissue of the body. Sarcomatoid subtype. Cell subtype of malignant pleural mesothelium that is less common. Cells of the sarcomatoid subtype are spindle-shaped and in disorganized patterns. Satellite metastases. Small melanoma tumors, satellites, in the skin within 2 cm from the first tumor. Satellite recurrence. Cancer that came back after treatment and formed small melanoma tumors in the skin within 2 cm from the first tumor, but outside of the surgical scar. Scalene lymph nodes. Groups of disease-fighting cells that are within the neck. Scalpel. Knife used for surgery. Scar. Permanent mark on the skin after an injury or surgery. Scintigraphy. Test that uses radioactive tracers to view body parts. Screening. Testing done on regular basis to detect disease in someone without symptoms. Also called screening tests. Screening tests. Testing done on regular basis to detect disease in someone without symptoms. Also called screening. Secondary cancers. Cancers that start in cells that were damaged from the treatment of the first cancer. Secondary resistance. Lack of treatment response that starts after taking drug for a while. Secondary tumor. Mass of cancer cells made fro, cancer cells that had spread fro, the first mass. Second-hand smoke. Inhaled smoke fro, lit smoking product or that was exhaled fro, smoker. Second-line treatment. The next treatment used against disease when the first treatment fails. Sedative. Drug that helps person to relax or go to sleep. Segmentectomy. Surgical removal of large part of lobe. Selective estrogen receptor downregulator, SERD. Cancer drug that blocks the effect of estrogen. Selective estrogen receptor modulators, SERM. Cancer drug that blocks the effect of estrogen. Self-exa, skin. Careful review of one's own skin for abnormal-looking spots that may be signs of skin cancer. Semen. Mix of fluids and sperm. Also known as ejaculate. Seminal vesicles. Pair of male glands that makes fluid used by sperm, for energy. Sentinel lymph node. The first group of disease-fighting cells to which cancer cells spread after leaving the first tumor. Sentinel lymph node biopsy. Surgery to remove the first group of disease-fighting cells to which cancer cells spread after leaving the breast. Also called sentinel lymph node dissection. Surgery to remove the first group of disease-fighting cells to which cancer cells travel after leaving the primary tumor. Sentinel lymph node dissection. Surgery to remove the first group of disease-fighting cells to which cancer cells spread after leaving the breast tumor. Also called sentinel lymph node biopsy. Sequential chemoradiation. Chemotherapy followed by radiation therapy. Serous. The outer layer of the colon wall that makes lubricating fluid. Serous ovarian cancer. One of 5 types of cancer that starts in the tissue lining around the ovaries. Serpentine asbestos. Group of asbestos fibers that are long, curly, and unlikely to break. Seru, free light chain assay. Blood test that measures the amount of the shorter fragments of the proteins made by myelin cells. Seru, immunofixation electrophoresis, SIFE. Test used to identify the type of M proteins in the blood. Seru, mesothelin-related peptide, SMRP. Protein in mesothelial cells that can be measured in the blood. Seru, protein electrophoresis, SPEP. Test that measures the amount of M proteins in the blood. Seru, quantitative immunoglobulins. Test that measures the amount of each class of antibodies in the blood. Seru, viscosity. Test that measures the thickness of blood. Sessile polyp. An overgrowth in the lining of the gut that has flat shape. Shave biopsy. Surgery to remove thin tissue sample fro, the top of tumor to test for cancer cells. Short-term, side effect. An unhealthy or unpleasant physical or emotional response to treatment that goes away after treatment ends. Side effect. An unhealthy or unpleasant physical or emotional response to treatment. Sigmoid colon. The last part of the colon on the left side of the body that is shaped like the letter S. Silic. Natural mineral mostly found in sand. Simple mastectomy. Surgery that removes the entire breast but no chest muscles. Also called total mastectomy. Simulation. The steps needed to prepare for treatment with radiation. Single agent. One drug that is used for treatment. Skeletal survey. Set of X-rays of the entire skeleton to look for broken or damaged bones. Also called bone survey. Skin biopsy. Removal of sample of tissue fro, the skin to test for disease. Skin-sparing mastectomy. Surgery that removes all breast tissue but saves as much breast skin as possible. Sleeve lobectomy. Removal of an entire lobe of lung and part of the bronchus. Small bowel obstruction. Blockage in the first part of the gut, small intestine. Small cell lung cancer. Cancer that started in small, round cells of the lung. Small intestine. The digestive organ that absorbs nutrients fro, eaten food. Smoldering myelin. Myelome that isn't causing symptoms or damaging organs. Snare. Medical tool that has wire loop to cut tissue. Social worker. An expert in meeting social and emotional needs. Soft tissue sarcoma. Cancer that starts in tissue that supports, connects and surrounds parts of your body. Solid nodule. Small mass of tissue with high density. Solitary plasmacytoma. Cancer that is one mass of myelome cells, abnormal plasma cells that grow and divide all the time. Soluble mesothelin-related peptide, SMRP. Protein in cells of the mesothelium, that can be measured in the blood. Sonogra. Computer picture of areas inside the body created by sound waves bounced off of tissues and organs. Spur. Sex cell furrow, man that invades woman's egg to make baby. Spinal anesthesia. Shot of drugs into the spongy tissue around the spinal cord that causes loss of feeling in the lower half of the body. Spinal cord. The bundle of nerves that runs fro, the base of the skull down the back and carries messages between the brain and other parts of the body. Spinal cord compression. Painful squeezing of the bundle of nerves in the spine. Spinal fluid. The fluid that surrounds the brain and spinal cord, the bundle of nerves that runs fro, the base of the skull down the back. Also called cerebrospinal fluid. Spine. The group of 33 bones, muscles and other tissues that extend fro, the base of the skull to the tailbone. Also called the backbone. Spirometry. Test that uses tube to measure how fast you breathe. Spleen. An organ that is to the left of the stomach and helps protect the body against disease. Splenomegaly. Enlargement of the spleen, which is an organ that helps protect the body against disease. Splint. Device used to support broken bone and hold it in place. Squamous cell carcinoma. Cancer that starts in thin and flat cells that line surface of organs. Squamous cell skin cancers. The second most common type of skin cancer. Squamous cells. Thin, flat cells that line many surfaces of the body. St. John's wort. An herbal product that is sometimes used to treat depression and that can affect how well certain cancer drugs work in the body. Stable disease. Cancer that is not getting worse or better in terms of its growth. Staging. The process of rating and describing the extent of cancer in the body. Staging procedures, surgical staging procedures. Procedures during surgery that are used to find out how far the cancer has spread. Standard care. The process that healthcare professionals should follow to treat medical problem. Standard open esophagectomy. Removal of the esophagus through large cuts into the body. STE, cell. An immature cell furrow, which other types of cells develop. STE, cell harvest. The process of removing blood STE, cells furrow, person. STE, cell transplant. Cancer treatment that destroys bone marrow with chemotherapy and then replaces it with healthy blood STE, cells. Stent. Tiny tube that is used to unblock duct. Stereotactic ablative radiotherapy, SABR. Treatment with radiation that is delivered with precise, high-dose beams. Stereotactic radiosurgery, SRS. Treatment of brain tumors with radiation delivered by precise, high-dose photon beams. Stereotactic guided biopsy. Use of mammography to guide needle into breast tumor to remove samples. Sternu. Flat bone in the center of the chest. Also called the breastbone. Steroid. Drug used to reduce swelling and inflammation. Drug used to kill myelome cells. Drug used to stop cells furrow, making testosterone. Stomach. An organ of the digestive cyst, that turns solid food into liquid form. Stool. Unused food that is passed out of the body. Also called feces. Stress incontinence. Leakage of urine when pressure is exerted on the bladder. Strip biopsy. The use of injections, tongs, and snares to remove small tumors. Strom. Supportive tissue in the breast. Structural tests. Tests that use machines. Subcarinal nodes. Groups of disease-fighting cells that are right below the bottom of the windpipe. Subcutaneous. Below the skin. Submucose. The second layer of the colon wall that is made mostly of connective tissue. Submucosal injection polypectomy. The use of injections and snares to remove small tumors. Subserose. The fourth layer of the colon wall that is made mostly of connective tissue. Subtype. Small groups. That type of cancer is divided into based on certain features of the cancer cells. Succinate dehydrogenase, SDH. Protein within cells. Sun protection factor, SPF. Rating of the level of protection sunscreen products provide against the UV rays from the sun. Superficial. At, on, or near the top or surface. Superficial spreading melanoma. The most common type of melanoma, it grows slowly and spreads from mole. Superior mesenteric artery. The large tube-shaped vessel that carries blood from the heart to the gut. Superior mesenteric vein. The large tube-shaped vessel that returns blood from the gut to the heart. Superior sulcus tumor. Mass of cancer cells at the top of the lung that easily grows into the chest wall. Supplement. Product that is added to the diet, such as vitamin, mineral, or herb. Supportive care. Treatment for symptoms of disease. Also called palliative care. Supraclavicular. The body erythroid is right above the collarbone. Supraclavicular lymph nodes. Groups of disease-fighting cells that are above the collarbone. Surface receptor. Protein found in the membrane of cells to which substances attach. Surgeon. Doctor who is an expert in operations to remove or repair part of the body. Surgery. An operation to remove or repair part of the body. Surgical exploration/evaluation. Surgery that assesses the extent of the cancer to see if surgical treatment is possible. Surgical margin. The normal-looking tissue around the edge of tumor that is removed during surgery. Surgical menopause. Sudden end of menstrual periods caused by surgery that removes both ovaries. Surgical oncologist. Doctor who is an expert in operations on cancer. Surgical staging. Procedures done during surgery that are used to find out how far cancer has spread. Surveillance. Follow-up testing that is done after treatment ends to look for new tumors. Switch maintenance. The stopping of all first-line drugs and the start of new drug. Symptom. Physical sign or patient report of health condition. Synchronous metastases. Cancer in distant sites that is found at diagnosis. Systemic radiation therapy. The use of radioactive drugs to treat cancer cells throughout the body with radiation. Systemic therapy. Drugs that are used to treat cancer cells throughout the body. Talc pleurodesis. Use of powder to seal the space that is within the lining of the lung to stop fluid buildup. Tamoxifen. Drug that blocks estrogen from attaching to cells and starting cell growth. TAND, STE, cell transplant. Planned, second STE, cell transplant that uses patient's blood-forming cells. Targeted therapy. Treatment with drugs that target specific or unique feature of cancer cells. Drugs that target specific or unique feature of cancer cells. T-cell. One of two main types of white blood cells called lymphocytes that help protect the body from infection and disease. Also called T lymphocyte. T-cell acute lymphoblastic leukemia. Fast-growing blood cancer, leukemia, that starts in an immature cell that normally becomes mature white blood cell called T-cell or T lymphocyte. Terminal deoxynucleotide transferase, TDT. Chemical found in type of white blood cell called lymphocyte or lymphoid cell. Testicles. Two egg-shaped glands found inside sac between the legs of man. Testosterone. Hormone that helps the sexual organs in men to work. Thoracentesis. Use of needle that is inserted between the ribs to remove fluid around the lungs. Thoracic inlet. The center of ring of bones at the top of the rib cage. Thoracic surgeon. Doctor who is an expert in surgery within the chest. Thoracoscope. Thin, long tube through which tools are inserted to do work inside the chest. Thoracoscopic biopsy. Use of thin tool that is inserted through small cut in the chest to remove tissue to test for disease. Also called VATS biopsy. Thoracoscopy. Use of thin tools that are inserted into thin, long tube in the chest to remove tissue. Thoracotomy. Removal of all or part of the lungs through large cut in the chest. Thorax. The chest area between the head and abdomen. Three-dimensional conformal radiation therapy, 3D CRT. Treatment with radiation that uses beams matched to the shape of the tumor. Thrombocytopenia. Health condition in which the number of platelets is below normal levels. Thymus. Gland of the immune cyst, that is located behind the top of the breastbone. Thyroid. Gland located in the throat, just beneath the voice box. T lymphocyte. One of two main types of white blood cells called lymphocytes that help protect the body from infection and disease. Also called T cell. Tomotherapy. Treatment with radiation of tumor slice by slice. Total abdominal hysterectomy, TAH. Surgery that removes the womb, uterus, through surgical cut in the belly area. Total mastectomy. Removal of the entire breast but no chest muscles. Also called simple mastectomy. Total pancreatectomy. Removal of the entire pancreas and other nearby organs and tissues. Total protein, urine. Test that measures the amount and type of protein in urine over 24-hour period. Toxin. Poison made in nature. TP53. An abnormal change in cells that causes Lymphoma syndrome. Trach. The airway between the throat and bronchi. Also called the windpipe. Transabdominal ultrasound. Test that sends sound waves through the skin to make pictures of the insides of the belly area. Transcript levels. The number of copies of certain genes, instructions for making and controlling cells, in your body found by very sensitive test. Transducer. Handheld tool that bounces sound waves off tissues to make pictures of the insides of the body. Transfusion. Replacing lost blood with new blood. Transhiatal esophagectomy. Removal of the esophagus through cuts in the belly area and chest. Transition zone. The inner part of the prostate around the urethra. Translocation. The switching of parts between two chromosomes. Transrectal. Through the rectum. Transrectal ultrasound. Device that is inserted into the rectu, and emits sound waves to make pictures of the prostate. Transthoracic esophagectomy. Removal of the esophagus through cuts in the belly area and chest. Transurethral resection of the prostate, TURP. Removal of some of the prostate through the urethra. Transvaginal ultrasound. Use of device that is inserted into the vagina and uses sound waves to make pictures of the insides of the body. Transverse colon. The second part of the colon that crosses from the right to the left side of the body. Treatment plan. Written course of action through cancer treatment and beyond. Treatment response. An improvement in disease related to treatment. Triple androgen blockade. Finasteride or dutasteride with combined androgen blockade. Trisomy 8. Health condition in which there are 3 copies of chromosome 8. True local scar recurrence. Melanoma cells not completely removed or destroyed by treatment, with cancer cells found in or right next to the surgical scar where the first melanoma was removed. Also called persistent melanoma. Tubal ligation. Surgery that seals the fallopian tubes so eggs from the ovary do not reach the womb. Also known as getting one's tubes tied. Tubular breast cancer. Cancer that started in the breast and has cells that look like tubes. Tumor. An abnormal mass of cells. An overgrowth of cells. Tumor burden. The extent of cancer in the body. Tumor deposits. The presence of tiny tumors where lymph drains through the tumor. Tumor depth. How far the tumor has grown into the structure it is affecting. Tumor excision. Removal of tumor with surgery. Tumor extension. How far the tumor has grown into nearby tissues. Tumor flare. An increase in testosterone after starting castration therapy. Tumor grade. How closely the cancer cells look like normal cells. Tumor infiltrating lymphocytes. The presence of white blood cells in tumor. Tumor location. The area of the body that contains the tumor. Tumor lysis syndrome, TLS. Condition that occurs when many cancer cells die very quickly and release their contents into the blood, which can damage the kidneys and other organs. Tumor lysis syndrome, TLS, panel. Test that measures certain chemicals that are released into the blood when cancer cells die. Tumor markers. Substances in body fluid or tissue that may be sign of cancer. Tumor regression. Decrease in the size of the tumor. Tyrosine kinase. Type of protein located on or near the surface of cells that sends signals telling cells when to grow and divide. Tyrosine kinase inhibitor. Type of drug that targets and blocks the protein made by the BCR-ABL gene so that it can't tell leukemic cells to grow. Tyrosine kinase inhibitor, TKI, therapy. Type of drug that specifically targets and blocks, inhibits, proteins called tyrosine kinases so the proteins cannot tell cells to grow and make more cells. U.S. Food and Drug Administration, FDA. Federal government agency that regulates drugs and food in the United States. Ulcerated or ulceration. Condition when the top skin layer of tumor is broken or missing. Ulceration status. Whether or not the top skin layer of tumor is present and intact, not ulcerated, or is broken or missing, ulcerated. Ulcerative colitis. An inflammatory disease of the colon. Ultrasonography. Test that uses ultrasound to view body parts. Also called ultrasound. Ultrasound. Test that uses sound waves to take pictures of the insides of the body. Also called ultrasonography. Ultrasound guided biopsy. Use of ultrasound to guide needle into breast tumor to remove samples. Ultraviolet, UV, radiation. Light energy with wavelength shorter than visible light but longer than X-rays. Invisible light energy that comes from the sun, sun lamps and tanning beds. Ultraviolet-UV, radiation. Long-wave invisible light energy that comes from the sun, sun lamps and tanning beds. Ultraviolet B, UVB, radiation. Short-wave invisible light energy that comes from the sun and in small amounts from tanning beds. Undifferentiated ovarian cancer. One of 5 types of cancer that starts in the tissue lining around the ovaries. Unilateral salpingo-oophorectomy, USO. Removal of one ovary and one fallopian tube that are on the same side of the body. Unresectable. Cancer that can't be removed by surgery. Upper gastrointestinal, GI, endoscopy. Use of thin, long tool that is guided into the esophagus and stomach. Uranium. Silvery white metallic chemical. Urethra. Tube that expels urine from the body. Also expels semen in men. Urge incontinence. The feeling of having to rush to urinate or you'll leak urine. Uric acid. Chemical that is made and released into the blood when cells and other substances in the body break down. Urinary incontinence. The inability to control the release of urine from the bladder. Urinary retention. The inability to completely empty the bladder. Urine immunofixation electrophoresis, UIFE. Test that identifies the type of M protein in the urine. Urine protein electrophoresis, UPEP. Test that shows the amount of M protein in the urine. Urologist. Doctor who is an expert in urinary systems and in male sex organs. Uterine sarcoma. Cancer that starts in the supportive tissue of the womb. Uterus. The female organ where babies grow during pregnancy. Also called the womb. Vaccine. Biological agent inserted into the body to prevent disease. Vaccine therapy. The use of vaccine to treat person with disease. Treatment used to help the body's disease-fighting ability, immune system, prevent disease. Vagin. Hollow, muscular tube in women through which babies are born. Also called the birth canal. Vas deferens. Tube-shaped male organ through which spur, travel fro, the testicles to the penis. Vasectomy. Surgery that seals the organ through which spur, travel fro, the testicles to the penis. Vein. Tube-shaped vessel that carries blood fro, anywhere in the body to the heart. Vemurafenib. Drug that treats melanoma targeting certain abnormal change in the instructions in cells for making and controlling cells. Venous access port. Small device that is inserted beneath the skin and into vein to give medicine. Venous thromboembolies. Dangerous blood clot in vein. Vertebrae. The chain of 33 bones in the back that protects vital group of nerves. Also known as backbone. Vertebroplasty. Procedure to strengthen bones in the spine with bone cement. Vertical growth phase. Downward growth of tumor into the skin. Video-assisted thoracic surgery, VATS. Use of thin tool that is inserted between the ribs to do work in the chest. Video-assisted thoracoscopic surgery, VATS, biopsy. Use of thin tools inserted through one or more small cuts in the chest to remove tissue to test for disease. Villus adenome. An overgrowth within the guts lining that has ruffled structure. Virtual colonography. Test that fills the colon with air and then uses computed tomography, CT, to make pictures. Visceral. Reference to the intestines that digest food, the gut. Visceral organs. Soft tissue internal organs such as the intestines that digest food. Visceral pleura. The inner layer of the tissue lining around the lungs. Also called pulmonary pleura. Vital organ. Functional group of tissues in the body that is needed to live. Volume displacement. The shifting of breast tissue. Vulve. The female organs between the legs. Wedge resection. Removal of small part of lungs lobe. Wheezing. Hoarse, whistling sound while breathing. Whipple procedure. Removal of the head of the pancreas and parts of other nearby organs. Also called pancreatidoadenectomy. White blood cell. Type of blood cell that fights infection. Whole breast radiation. Treatment of the entire breast with radiation machine outside the body. Wide excision. Surgical treatment that removes the whole tumor and some surrounding normal tissue. Widespread metastatic disease. Cancer that has spread the first tumor to many distant sites in the body. Windpipe. The airway between the throat and bronchi. Also called trachea. Wire localization biopsy. Use of wire that is guided into tumor by mammography to find which tissue to remove. Womb. The female organ where babies grow during pregnancy. Also called uterus. Xeroderm pigmentoso. An inability of the skin to repair damage ultraviolet light. X-ray. Use of small amounts of radiation to make pictures of the insides of the body. Yellow marrow. Type of bone marrow that consists mainly of fat cells. Chapter 3. A Cancer Dictionary/Glossary from cancerindex.org. cancerindex.org/medterm. cancerindex.org/glossary.htm. Ablative iodine, I-131. Therapeutic doses of radioactive iodine with the AI of destroying all remaining thyroid tissues. Acute. Means sudden or severe. Adjuvant chemotherapy. Chemotherapy given as an add-on to primary cancer treatment, as in surgery or radiotherapy. Adriamycin. A trade name for doxorubicin, see entry. Age-adjusted mortality rate. Age is a very important factor in determining mortality. For example, people tend to get different cancers at different ages. To compare the mortality rates of two or more populations, differences in the age distributions of the population are removed by using an age-adjusted rate. Aplastic anemia. Anemia that is resistant to treatment, often accompanied by deficiencies of other blood cells. Autosome. Any non-sex determining chromosome. In humans there are 22 pairs of autosomes. Barium enema. A barium enema, or lower GI series, is procedure that uses a barium sulfate enema followed by an X-ray to view the colon and rectum. Barium sulfate is a chalky chemical that appears white on X-ray fill, thus showing the lining of the colon. This helps identify any abnormalities which usually appear darker on the X-rays. Sometimes air can also be pumped into the intestine in order to sharpen the image. Biopsy. This is the removal of a small section of the tumor. The sample will be analyzed by a histopathologist in order to establish a precise diagnosis. Surgical procedure. This may be a needle biopsy, where a very fine needle is used to take a tiny sample of the tumor. Occasionally a surgeon may remove the whole tumor prior to diagnosis, a resection biopsy. Cancer statistics. Cardiotoxicity. Damage to the heart is associated with certain anti-cancer drugs, especially adriamycin. As such, the total dose of these drugs may be limited to reduce the risk of cardiotoxicity. Cell differentiation is where normal cells go through physical changes in order to form the different specialized tissues of the body. Malignant cells may range from well differentiated, closely resembling the tissue of origin, or undifferentiated or anaplastic, bearing little similarity to the tissue of origin. In general, it is the undifferentiated or anaplastic histologies which are more aggressive. Central line. A thin plastic line into a vein in the chest used for the delivery of chemotherapy, e.g. Hickman registered catheter. Cervical cancer. Cervical cancer is a common type of malignancy, accounting for about 6% of all cancers found in women. It is a disease in which cancerous cells develop in the uterine cervix. This is the connecting passage between the uterus and vagina. The peak incidence of cervical cancer occurs between the ages of 40 to 55. It is rare before the age of 35, however, the incidence of cervical cancer in younger women rose dramatically during the 2 decades after 1960. Regular Pap smear tests may detect abnormal changes in the cervical tissues before cancer develops. Symptoms of cervical cancer may include vaginal bleeding after intercourse or bleeding between periods. However, in the early stages of the disease there are often no obvious signs or symptoms, so regular smear tests are important. Childhood cancer. Childhood cancer is rare. About 1 in every 600 children aged under 15 develop cancer. Still, very little is known about its causes. Compared with adult cancers, they tend to have different histologies and occur in different sites of the body. Common adult cancers such as lung, breast, colon, and stomach are extremely rare among children. On the other hand, some types of cancer are almost exclusively found in children, especially embryonal tumors which arise from cells associated with the foetus, embryo, and early postnatal period. The overall cure rate for childhood cancer has drastically improved over the last 2 decades in association with clinical trials and the development of new treatments. Chromosome. Structures in the cell nucleus which contain the genes responsible for heredity. Normal human cells contain 23 pairs of chromosomes. One of each pair is inherited separately from a person's father and mother. Clinical trial. Research conducted with patients, usually to evaluate a new treatment. Each trial is designed to answer scientific questions and to find better ways to treat individuals with a specific disease. Many times cancer patients can receive new, experimental treatments by participating in a clinical trial. Colorectal cancer is the second most common type of cancer, and accounts for almost 80% of cancers of the digestive tract. The vast majority of colon and rectal cancers are adenocarcinomas. Around 10% of these are mucinous, protein contained in mucus. Surgery is the main form of treatment, though modest benefits of adjuvant chemotherapy have been demonstrated. The median age at diagnosis is 70, age-adjusted incidence rates are slightly higher in males compared to females. A substantial proportion of cases are in those with a genetic predisposition to colorectal cancer. Diet may also have an influence on the incidence of colorectal cancer. Dietary fiber, retinoids, and calcium are thought to be protective, while high intake of animal fats may increases risk. Colorectal cancer may develop benign polyps. A polyp is a tumor on a STE, most commonly found on mucous membranes. Screening of high-risk populations, for those over age 50, particularly those with a first-degree relative diagnosed with colorectal cancer, or familial predisposition to adenomatous polyposis, may be of benefit in detecting colorectal cancer at an early stage. Cytokines, also known as colony-stimulating factors. DNA. This abbreviation stands for deoxyribonucleic acid. DNA is the component of the chromosomes that carries the genetic code. Dose intensity. In chemotherapy, the total amount of drug delivered in a 1-week period can be given all at once or over a period of several days. Doxorubicin. Doxorubicin hydrochloride, an antibiotic used to treat several forms of cancer. Also known as adriamycin. Enteral feeding. A method of nutrition delivery where fluid is given directly into the gastrointestinal tract. Enucleation. Removing the entire eyeball, this operation may be used for advanced stage or large ocular tumors. For some smaller malignant tumors, laser treatment may be used, in conjunction with chemotherapy, in which the eye can be salvaged. Epidemiology. The study of the distribution and causes of diseases in a population. Fluorescein angiography. The process of taking X-rays of blood vessels that have been injected with a special dye. The dye allows to person viewing the X-ray to see the blood vessels. Follow-up. When treatment is complete, the periodic visits to the physician are needed to monitor the patient and ensure there has been no recurrence of the disease. Fractions, RT. The radiotherapy dose is divided into a number of smaller doses, known as fractions, to reduce the risk of side effects. There is normally 1 fraction per day. Hematology. The branch of medicine that specializes in the study and treatment of blood and blood tissues, including bone marrow. Hamartoma. A benign nodule/overgrowth of normal mature cells that are normally located in the affected part of the body, usually with one particular type of cell predominating. Hodgkin's disease. A malignancy of the lymph tissue, lymphoma, that occurs most often in males, and the peak incidence is between ages 15 and 35. It is characterized by progressive, painless enlargement of the lymph nodes, spleen, and general lymph tissue. Hyperfractionated radiotherapy is where more than 1 radiotherapy fraction is given per day. I-131. Radioactive iodine. Iodine is readily uptaken by the thyroid gland, therefore I-131 may be used in small doses for monitoring thyroid tissues, thyroid scanning or I-131 challenge, or in large doses for treating thyroid cancer, ablative I-131. Immune system. The body system, made up of many organs and cells, that defends the body against infection, disease, and foreign substances. The immune system is often stimulated in specific ways to fight cancer cells. Immunosuppression. The prevention or suppression of the immune system. For example, some drugs may have the side effect of dampening the immune system, making the patient prone to infections. Immunotherapy. Treatment of disease by stimulating the body's own immune system. This is a type of therapy currently being researched as a treatment for cancer. Interferon. Interferons are proteins produced by the body with the specific purpose of regulating cell functions. Interferons are produced in the laboratory in large quantities, and are sometimes used in the treatment of certain cancers. Interleukin-2. A hormone-like substance produced by the body, certain blood cells, specifically, that stimulates the growth of blood cells important to the body's immune system. Intravenous. 4. Means into a vein. Laser therapy. Treatment using a powerful, focused BEA, of light that produces intense heat used to burn away cancerous or damaged tissue. Leukemia. A progressive, malignant disease of the blood and blood-forming organs, characterized by overproliferation and development of leukocytes, a type of white blood cell. There are many different forms of leukemia. Li-Fraumeni syndrome/TP53. Lobe. A portion of an organ such as the liver, lung, breast, brain, or thyroid. Li-Fraumeni syndrome. A family cancer syndrome. Lymphocytes are a type of white blood cell that fights disease and infection by producing antibodies and other protective substances. There are two categories, A, B cells. These recognize specific antigens and produce antibodies to combat them, and B, T cells, which are produced in the lymph system, and work in conjunction with the immune system. Magnetic resonance imaging, MRI. A technique used to image internal structures of the body, particularly the soft tissues, muscles, organs, tendons, etc. An MRI image is often superior to a normal X-ray image. Malignancy. The tendency of certain diseases to become progressively worse. A malignancy is often resistant to treatment and can result in death. Monoclonal antibody. An antibody produced in the laboratory that can target specific antigens, substances that provoke an immune response. They can be made in large quantities, and are being tested for their use in cancer diagnosis and treatment. Multiple myeloma. A cancer of the white blood cells found in the bone marrow. Neoplasm. A new growth of tissue serving no physiological function. Nephrotoxicity. Some anti-cancer drugs may have the side effect of damaging the kidneys, for example ifosfamide and cisplatin are known to be nephrotoxic. There are two categories, glomerular and tubular toxicity, relating to the two main areas of the nephron. In studies of ifosfamide, the degree of nephrotoxicity is thought to be related to the cumulative dose, but there is a good deal of variability between patients. Neutropenia. Below normal levels of leukocytes in the blood. Febrile neutropenia, neutropenia with fever, is a common toxicity following chemotherapy. Oncologist. A physician who, after extensive training, specializes in cancer treatment. Osteomyelitis. Inflammation of bone, infection. Osteoporosis. Reduction in bone mass equals prone to fractures. Pediatric oncology. The branch of medicine which specializes in the study and treatment of childhood cancer. Treating children requires different considerations compared with adult oncology. For example, potential treatment side effects may be different to those in adults. Because of the differences between childhood and adult cancers, most children are treated in specialist pediatric oncology units. In the UK, about 80% of children are treated at a UXC center. Paget's disease. Not a cancer. Paget's disease is the most common bone disorder characterized by irregular thickening and softening of the bones. The disease is more common after the age of 40, and is frequent in those of European descent but rare in Asians. These is an association with this, non-malignant, disease and bone cancer. Up to 10% of those with Paget's disease will have a sarcomatous transformation of affected bones, giving rise to bone sarcoma. This may be osteosarcoma, fibrosarcoma, chondrosarcoma, or other bone sarcomas. Pancytopenia. Deficiency of all types of blood cells. Pap test. This is a simple microscopic examination of cells, which can detect cancer of the cervix at an early stage. Partial thyroidectomy, removal of part of the thyroid, e.g. lobectomy or hemithyroidectomy. Total thyroidectomy, removal of all of the remaining thyroid gland. Pathology. The branch of medicine concerned with disease, especially its structure and its functional effects on the body. Peripheral blood stem cell rescue. PBSC. Phagocytosis. Cell eating, the engulfment and destruction of dangerous microorganisms or cells by certain white blood cells, including neutrophils. Phase I clinical trial. Tests new types of treatment and AI, to define a safe dose that will be used for further studies. This is usually the first testing of a treatment on humans after extensive laboratory work. Recruitment for Phase I trials are usually FRO, patients for who, no other effective therapy is known. Plasma cells. White blood cells. Platelets. A blood component that is instrumental in clot formation, which stops bleeding in injured areas and prevents hemorrhage. Blood cell fragments containing clotting factors which prevent bleeding and bruising. Polyp. A benign growth protruding FRO, a mucous membrane, commonly found in the nose, uterus, and rectum. Certain polyps, particularly those found in the colon, can become cancerous and may require surgical removal. Prostate gland. A gland in men that surrounds the neck of the bladder and urethra. The prostate contributes to the production of seminal fluid. Pyrexia. Fever/abnormally high body temperature. Radiation enteritis. Functional disorder of the large and small bowel that occurs during or following a course of radiotherapy to the abdomen, pelvis, or rectum. Radiation therapy. Cancer treatments which utilize high-energy waves or particles of radiation. Recessive. Genetics, if the required allele, a type of gene, is not present in both members of a pair of chromosomes, then that allele is not expressed. A mutation is said to be recessive if an individual must inherit 2 copies of the mutant gene, one FRO, each parent, to show the mutant trait. Individuals with 1 mutant and 1 normal gene appear normal. They are called acarioso. Red blood cell. Red blood cell, erythrocyte oxygen-carrying cell in the blood which contains the pigment hemoglobin, produced in the bone marrow. Reed-Sternberg cell. A type of cell that indicates the presence of Hodgkin's disease. The number of these cells increases as the disease progresses. Regional. A tumor that has extended beyond the limits of the organ where it started, growing directly into surrounding organs or tissues, but has not spread to distant parts of the body. Risk factors. Anything that has been identified as increasing an individual's chance of getting a disease. Sarcoma. A cancerous growth of the bone, muscle, or connective tissues, usually appearing first as a painless swelling. Sigmoidoscopy. A procedure in which a scope is used to view the sigmoid flexure, a part of the colon that's shaped like the letter S. Surgery. An operation. Thyroidectomy. Surgical removal of the thyroid gland. Thyroxine. A hormone produced by the thyroid gland. It contains iodine, which is essential for the body's normal growth and metabolism. Following therapy for thyroid cancer, many patients need to take thyroxine supplements in order to maintain normal weight and body functions. Total body irradiation. Radiation to the whole body. Toxicity. Side effects of treatment. Tumor marker. A substance in the body that may indicate the presence of cancer. Markers may be secreted by the tumor itself or produced by the body in response to the cancer. Tumor markers may aid diagnosis or give an indicator of how treatment is progressing. These markers are usually specific to certain types of cancer. For example, neuron-specific enolase, NSE, is associated with a number of types of cancers, in particular neuroblastoma. Also, alpha-fetoprotein, AFP, levels are often abnormally high in patients with GER, cell tumors. Ultrasound. The use of sound waves to image the underlying structures of the body. Ultrasonic waves are reflected differently depending on the type of tissue they pass through, aiding the detection of abnormal tissues. X-ray. 1. Low-dose radiation used to make images of internal body structures, or, 2. High-dose radiation used to treat cancer. Chapter 4. Cancer Dictionary website / Cancer Glossary websites. Try hashtag 610.3 or R121.18 at the library. nlm.nih.gov/medlineplus/medicalwords.html, understanding medical words. ecancerpatient.org/glossary.php. 9-11.com/medref/medicaldictionaries.html. Acronyms.thefreedictionary.com. health.m/acronyms, Dictionary of Medical Acronyms and Abbreviations. acticare.com/jargon.asp. advancedtherapynetwork.com/glossary. alzrv.rug.ac.be/rvdsdh/eugloss/dic, Medical Dictionary. bc.simpatico.ca/me/patientsguide/glossary.htm. medwordlist.com. books.md, Medical Dictionary search engine, a very large list of medical terms and definitions. calpatientguide.org/glossary.html. cancercenter.com/glossary. livingahealthylifestyle.com/healthterms.html. cancerweb.ncl.ac.uk/omd, OMD is a searchable dictionary. chorus.rad.mcw.edu/index/6.html, Dictionary of Orthopedics. cll.ucsd.edu/glossary.htm. pacmedinet.com/keywords.php. cts.usc.edu/glossary of terms.html. danafarber.org/canbwh/dictionary. dfci.harvard.edu/can/dictionary. dictionaryapothecary.on.ca/articles.asp, Medical Dictionary. dictionary.webmd.com. directhit.com/insres/medical-slang-terms.html. disabled-world.com/definition/medical-glossary.php. bcbs.com/coverage/glossary, healthcare coverage glossary. dmu.edu/medterms/welcome, medical terminology short course. drugs.com/dict. drugs.com/dict-w0.html. mondofacto.com/dictionary/contents/w.html, Mondo Facto Dictionary. The Mondo Facto Dictionary is a searchable dictionary of terms from medicine, science, and technology. drugs-dictionary.com. ctru.auckland.ac.nz/medglossary/a.html. en.wikipedia.org/wiki/list_of_medical_topics. erheadquarters.com/doctors_chart/medical_terms.htm. explore-health.com. fasthealth.com. fasthealth.com/dictionary. faunen.com/medref/refs.html, references for medical notes. findcounseling.com/glossary, interactive glossary of mental health and disability terms. free-medical-dictionary.com. gen.emory.edu/medweb. ghr.nlm.nih.gov/glossary. graylab.ac.uk/omd, online medical dictionary. health.gov. health-dictionary.com. health-dictionary.com/mental-health-terms. healthdictionary.info. healthfinder.gov, medical dictionaries. healthkeywords.net. hoacne.com/html/resources.html. hyperdictionary.com/medical. intellihealth.com. intellihealth.com, dictionary. intellihealth.org, enter Merriam-Webster. jklcompany.com, medical dictionary. chemc.edu. lpi.oregonstate.edu/infocenter/glossary.html, Linus Pauling Institute. medforumslive.com/dictionary. medicate.com/medical dictionary. medical.merriam-webster.com. medical-dictionary.com, medical-dictionary.thefreedictionary.com, medilexicon.com/medicaldictionary.php, medical-dictionary.thefreedictionary.com, medical dictionary, medical-glossary.com, medicalglossary.net, medicalglossary.org, medicalrace.com/dictionary, medicinenet.com, medicinenet.com/alphaidx.asp, medicineword.com, medilexicon.com, pharmaceutical and medical abbreviation dictionary, medilexicon.com/medicalabbreviations.php, medindia.net/glossary, medipor.org, meditech.com/alternative-medical-words.html, medpen.net, meds.com/glossary.html, medtech.net, medterms.com, mediword.com, mediwordlist.com, members.shaw.ca/copingwithillness/glossrevbea.html, conceptual glossary of medical terms, mentalhealth.samhsa.gov/publications/allpub/mc98-70/default.asp, managed care glossary, National Mental Health Information Center, merck.com/pub/mmanual, msjensen.cehd.umn.edu/1135/med_term_activities, medical terminology prefixes, mtdesk.com, mtdesk.com/alpha.shtml, medical/surgical word glossary, mtdesk.com/frame.php ?frame resources, mtdesk.com/tiki-index.php page medical+terminology, medical transcription, m-w.com/mwmedical/medical.htm, medical dictionary, mwsearch.com, medical world search engine that understands medical terms, ncbi.nlm.nih.gov/about/outreach/glossary.html, needtogetiinsurance.com/healthglossary.html, nhsdirect.nhs.uk/glossary, nlm.nih.gov/medlineplus, nlm.nih.gov/medlineplus/encyclopedia.html, medical encyclopedia, nlm.nih.gov/medlineplus/m+dictionary.html, medical dictionary, online-medical-dictionary.org, free medical dictionary, online-medical-dictionary.org, paulsmith.doctors.org.uk/archaic medical terms, pharma-lexicon.com, reference.md, sciencedaily.com/encyclopedia/health_science, sciencedaily.com/encyclopedia/list_of_medical_topics, sciencecom.at/advice/dict.html, scl.ncal.kaiperm.org/glossary, Kaiser Permanente's medical glossary, stenograph.com/educational/ref_Stedman dict, sdjude.org/glossary, tabors.com, Tabor's medical dictionary, thefreedictionary.com, umm.edu/glossary/c, washington.edu/health-research/definitions.html, webmd.com/a-to-z-guide/common-topics/default.htm, medical library, wheelusonline.com, Wheelus Textbook of Orthopedics, by C.R. Wheelus MD, hunamedit.com, hunamedit.com, Who Named Diseases, wiki-trust.cse.ucsc.edu, yamabay.com/medical_terms.asp, your-doctor.com/health-infocenter/medical-conditions, abtia.org/understanding-brain-tumors/brain-tumor-dictionary, brain tumor dictionary, cancervictors.net/resources/glossary. cancer.org/cancer/cancer-glossary/index, cancer glossary. nlm.nih.gov/medline+/m+dictionary.html, Medline Plus. Medical Dictionary. mondofacto.com/dictionary, mondofacto, online medical dictionary. cancer.gov/dictionary, NCI Dictionary of Cancer Terms. genome.gov/glossary, talking glossary of genetic terms. cancer.gov/published content/js/term dictionary.